So I'm going to begin. We're really excited. There may be some people coming in. Let me see, I think I can, oh, that's exciting. All right, through the gallery. We're really excited to have all of you here. We've met some of you. I just want to begin by introducing myself and Marilyn Parks. Marilyn will introduce herself when she's going to begin her presentation. My name is Suzanne Gordon. I'm privileged to be on the steering committee of the SOVA VA group of Veterans for Peace. I'm not a veteran, but I'm an associate member of Veterans for Peace. And I've worked with many of you before and know many of you. And I am really a representative of the Veterans Healthcare Policy Institute, and I would encourage you, it's going to be in the chat, to subscribe to the Veterans Healthcare Policy Institute newsletter to familiarize yourself more with the issues and keep abreast of what's changing, because I know that you're all activists and committed to this issue. And I want to introduce, I'm not sure how this is done technologically, but the steering committee members, the real people who do the work, which isn't me, are Bruce Carruthers, Arliss Harem, Jeff Roy. Let me see, are you going to come on? So Jeff Roy, Mark Foreman, and let's see, is there somebody I've missed? Pardon? Bruce, Jeff, Mark. Art isn't here, is he?
No.
Okay. Art Radcliffe isn't here, so I think that you are all the people who are here, and I just really want to give a shout out to you all. You know, this is a very small group with a very big impact. And you are doing what the very well-financed and huge veteran service organizations like the Legion and the VFW that have, you know, over 1 million members should be doing and aren't. And so I just, you know, the fact that we have 20 people here or whatever, or that we only have, you know, 4,000 members in VFP, and I don't know how many, 700, you know, folks who write letters to Congress, it really shouldn't dissuade you. It should encourage you, because this group is really the people that are standing in the way of, in my view, total disaster. And we may not be winning, but we're making it harder for them to do really bad things and to make things even worse, and we are winning in some respects. So with that said, I wish we could have the time to get everyone, to have everyone introduce themselves, but if we did that, it would take up too much time and we'd be here even longer. So if folks want to put in the chat, you know, who they are and why they've come, that would be great, and people can look in the chat and see that. Pretty much most of you use the VA for your healthcare or some of your healthcare. So this is an issue that is both politically important and also very personally important to many of you. I mean, I wish I could use the VA for my healthcare, and I know a lot of VA docs and nurses who I routinely call and consult with for my healthcare too. But that said, I want to really go into a very brief overview of what the status of the issues are and what we're facing. You have this fact sheet. I'm not using a PowerPoint, and I'm not going to go over a lot of the great things about the VA, but it's very important for folks to know and to really kind of come out of the gate with a very confident assertion that the VA is probably the most successful healthcare system in the United States. And what you're defending is the only actual national health system in the country. It's the only publicly funded national health system in the country. It's the only integrated and coordinated health system in the country. And that's why its outcomes are so stellar. And a lot of people that you're going to be going to meet with in Congress, and folks, I know that you must have had this experience when you talk to people, your friends and relatives and community members, and if you go to church, people in church or wherever, because for the past 10 years, the media, thanks to the Koch brothers, multi-million-dollar effort to tarnish the reputation of the VA, which was wonderful, previous to their effort. The people really think now that the VA is a bad system. I know a lot of vets who use the VA who think their VA is great, but the VA, in the community next door or in another state is terrible. I once sat with a group of vets in Milwaukee in a PTSD session, and this VA is great, but every other VA is awful. And the very first thing you have to refute when you do advocacy around the VA is this notion that it's a broken system. It is not. It is the best healthcare system in the country. You may have problems with it. How could the largest healthcare system in the country not have problems, right? How could, of over 300,000 employees, how could there not be a couple that, got out of the bed on the wrong side one day? Clerks that don't get it, et cetera. But the outcomes are stellar, and the personal experiences, in the most part, are also great. And that's why they're spending so much money trying to wreck it. If the VA was a bad healthcare system, the Koch brothers wouldn't have to devote over $12 million a year to tarnishing its image. The work would have been done for them. So basically, there's some very fast facts here, and I would encourage you to kind of get very familiar with them, because you have your own personal experiences, but it's really great to say, wait a minute, we have hundreds of studies that document that VA delivers superior care to the private sector at less cost. And this is, by the way, doing it with one hand tied behind their back, because they have never been adequately funded and adequately staffed. So you have a healthcare system with one hand tied behind its back, maybe sometimes two, that is still beating the private sector in cost and quality. And you have to really make that case. The other case you have to make, and you're going to encounter this with these, senators and congressmen, is why do you want more money? We've already increased the budget of the VA by X% a year. Well, if you need 120 million and they give you 90, if you need 120 billion and they give you 90, and last year they gave you 70, they give you 20 billion more, but you need 50 billion more, you can thank them for their service and their contribution, but we still need more. I mean, wouldn't it be great if every time they increase the Pentagon budget by 20%, they increase the budget of the VA by the same thing, right? Actually, that should be a demand. So you're going to get that. Another thing you're going to get is that there's a declining veteran population. Indeed, there is. But the problems that they have are much worse. Why? Because people particularly who are in combat would have died of their injuries in Korea and World War II and World War I. They'd be dead. You wouldn't have to take care of them, right? But now they come back from combat with 16 different presenting problems. In the trade, we call them comorbidities. They have 16 different conditions. And those conditions get worse as you get older. You all are older. You can attest to this. You can say, I came back from Vietnam with X, And now I have X and I have Y and Z, and plus I have A, B, and C, because I'm getting older, and you just get the normal problems of aging. So the fact that you have a declining population doesn't mean that you have declining need for care. You actually have, as they age, an increasing need for care. That's a very important fact. Another very important fact is that it's not just combat vets who need health care. The US has, the DOD is a reckless employer from the point of view of safety. 126 American bases have been declared by the DOD to be contaminated with all kinds of contaminants in the water supply. And people get cancer and this, that, and the other thing. So, and people get PTSD and MST, military sexual trauma, without ever having to left America. So I just want you to know that, there's certain kinds of thematics that you will encounter when you talk to these the staffers or political representatives. Declining vet population means that we don't need as many facilities and caregivers and programs. Well, excuse me, what about the 4 million veterans who we know have been exposed to toxic exposure since 1990? 4 million of them. That's not a declining, the veteran population may be declining in broad numbers, but the number of people who need healthcare because of reckless practices by the military and being in wars and so forth is actually increasing, and the number of problems is increasing. So, 10 years, in World War II, you might have had somebody with 4 problems. In Iraq, they have 16. This is true, right? The average Medicare beneficiary at 65 has 3 to 5 presenting problems. The average Vietnam vet has 9 to 12. So you have a very complex patient population. This is not, and this is important to know because private sector providers, where they're outsourcing patients to, don't know about the problems that you have, right? They don't know how to recognize the difference between asthma, regular asthma, and burn pit related respiratory problems. They don't know, the difference between me complaining about insomnia and nightmares and Dan Shea complaining about insomnia and nightmares, right? I have a friend who's a Vietnam vet who went to his primary care provider, non-VA provider, didn't even know he was a vet. The guy said, I'm having nightmares and insomnia, and he was prescribed Ambien, which is contraindicated for PTSD, which is what he had, but the provider didn't know that he was a vet. And, what we are facing now, so this is a general thematic of some of the kinds of attitudes that you will be confronted with. Another kind of attitude you'll be confronted with is the assumption that the private sector always does better than the government. You have to counter that, right, with your own experiences, right? Even those of you probably who go to the VA have had private sector experiences, your family members have. These people love anecdotes, right? They love anecdotes. Don't be afraid to be emotional with them. Don't get angry. But, I was in a meeting with Mick Cole and a bunch of you when we did the lobbying thing in 2019, and Mick was amazing. And he talked about his experiences and kind of choked up, and that was very effective, But let me just give you a bit of the lay of the land, and one could take up the entire 3 hours with this, but I'm going to try to speed wrap you through it. Most of you know that in 2018, they passed the VA Mission Act of 2018. This was a Trump initiative that tragically the veteran service organizations lobbied very hard for. And it essentially, and the Democrats, most of the Democrats, with the exception of Bernie Sanders and Pelosi and 79 of her colleagues in the Senate, in the House, and essentially there would have been much more Democratic opposition had the VSOs not really done the wrong thing, in my view. And this law allowed more outsourcing of care to the private sector than the Choice Act that had preceded it, which was supposed to be temporary and last 3 years and sunset, and John McCain made a deal with Bernie Sanders, which he reneged on. Robert Wilkie, the act itself did a couple of things. One of the things it did was give the secretary very broad latitude to change access standards. Under the Choice Act, you could go to private sector care. I think if you had to wait more than 30 days for an appointment and drive more than 40 miles, Wilkie drastically changed the access standards. It was supposed to be medical necessity and medical need, and he changed it to if you have to wait more than 28 days or drive more than 30 minutes for an appointment for primary care, mental health care, you could go to the private sector. And if you had to drive more than 60 minutes and wait more than 30 days for a specialty appointment, you could go to the private sector. So, you know, there's almost nowhere where, I mean, I have to drive. I don't live in a rural area, but, you know, with traffic, if I want to go from where I live to Oakland, there's almost no way I can get there in less than 30 minutes. And so, you know, this drastically increased the private sector care that veterans could have, and really created a flood. Now, there were no standards imposed, and this is going to come up a lot, and this is very important. There were no similar wait time standards imposed on the private sector provider. So you can call up the VA and ask for an appointment for dermatology in White River Junction, Vermont, and be told, well, you have to wait 40 days, and they'll push you in to the private sector to what is called community care, the CCN, the Community Care Network, and discover that the wait time for a dermatologist in Vermont is 8 months. That doesn't count. That's not a problem to them, right? So, and there's also, and this will come up in your breakout sessions, there are no quality standards imposed or rigorous training imposed on non-VA providers. VA providers have to go through all kinds of training, suicide prevention. You know, I mean, they take care of veterans. The only people they ever see are veterans, right? So they kind of know about veterans. You kind of have to. Private sector doctors may take care of, in their patient panel, they may have 1 to 5% of veterans. So that means if you have a panel of 2,100 patients, you might have 2, you know, who are veterans. So why would you learn about veterans if you know 2 or 20 or 50 of your 2,000 patients are veterans? And they have fought tooth and nail to not apply. The private sector insurer, big companies, healthcare companies, have fought tooth and nail not to have requirements imposed on them that they understand anything about military culture, PTSD, military sexual trauma, burn pits, anything connected to veterans. The RAND Corporation did a study of New York State and discovered providers in New York State, PTs, physician assistants, nurse practitioners, physicians, and mental health providers. New York State has the 5th largest veteran population in the nation. And they discovered that the vast majority of these providers said they would be happy to take care of veterans. The vast majority said that they knew nothing of veterans, and the vast majority who knew nothing about veterans said that they weren't interested in learning anything about veterans, you know, at all. And also, when they looked at mental health providers, they discovered that 70% of these providers, 70% didn't use evidence-based therapies for their non-VA patients. this is a study that should have been done for every state before the Mission Act. The other thing that the mission, so we have a huge amount of patients going into a private sector where we know the care is inferior and costs more. A recent Stanford study, which was just published in the British Medical Journal, looked at 400,000 emergency room visits where veterans were dual eligible. They had Medicare and they had VA care, and they were randomly assigned by the ambulance driver to a private sector or VA hospital. They discovered that their 28-day mortality increased. They were 20% more likely to die in a non-VA ER, and it cost 21% more to pay for that death. So you, James, and Ray, and Mark, if you go to a private sector ER, your chances of dying increase by 20%, right? I read that study and I thought, why am I going to private sector ER? Why can't I go to the VA? And the reason why the outcomes are better is because of coordinated care. Now, if you all go to our blog on VHPI website, if you go to the blog, veteranspolicy.org, you will see those two articles about that study. And a VA primary care doc explains exactly what coordinated care means in the VA. Coordinated care does not mean that you share the same medical chart. That helps, right? And the private sector providers in VA don't. But coordinated care means that, the pulmonologist speaks to the cardiologist, speaks to the oncologist, et cetera, speak to the psychologist, and you have people actually planning care for the patient and communicating via the chart and in person, because you work in the same system and because you're mission driven, not profit driven, because it's not a fee for service system. Everybody is on salary at the VA, so there is no incentive to overtreat or undertreat, right? This is extremely important. And I think if you go to Congress, it's pretty important to have just a couple of quick facts, that we know that dialysis is better and cheaper, mental health is better and cheaper, diabetes management is better and cheaper, ER care is better and cheaper. It's a primary care-based system, unlike the private sector, and care is actually coordinated. Now, the other thing to know is that there was the Mission Act, there was the John Scott Hannon Act. There is a mental health bill that's now, John Scott Hannon is trying to outsource mental health care for veterans and their families to providers in the private sector. They call it the community, as if the VA isn't part of the community. I never use the word community care. I always use the word private sector care. It's not community care, it's corporate care. And I mean, it's up to you, you can call it community care, but I always use the term private sector care. And there's all kinds of bills. There's now a bill that Marilyn will mention that we're trying to impact, but they're trying to outsource homeless substance abuse care for homeless veterans. One of the things they will tell you in your meeting is, well, we have to outsource this care to the private sector because the VA can't take care of some patients because they're not eligible, because they have bad paper discharge and other than honorable discharge, because they have too high an income or no proven service-connected disability. If that's your issue, and if you want to take care of vets who are ineligible because of their discharge status, their income, or their lack of proven service-connected disability, that is extremely simple to do. Just change the rules, as Swords to Plowshares has asked VA in a rulemaking petition, or change the rules legislatively to allow other than honor people with bad paper, OTHs, to get their care at the VA. Simple thing. I mean, there's been a long discussion about this. and get rid of these cockamamie eligibility standards and fund the VA so that it can take care of all veterans. I mean, why is it, you should ask these Congress people, that you are willing to pay more for inferior care for these quote unquote ineligible veterans if they promise to go to the private sector? Why? I mean, these bills establish an important precedent, which is we will pay for ineligible veterans if they go to the private sector. They're establishing that precedent. So why not change the rules and allow them all to go to the VA and staff and fund the VA so it can accommodate them, because they know what they're doing at the VA and they don't in the private sector, and care is fragmented and so forth. Okay, the final thing I want to talk to you about in this speed wrap is the Air Commission. This is the biggest danger we face. I think Marilyn will, I don't know, this is a disaster in the making. The Air Commission is part of the Mission Act. It is, remember this, and this section of the Mission Act was written by the Koch brothers, Darren Selnick, who was ensconced in the White House under Trump and in the VA. And it establishes an Asset and Infrastructure Air AIR Commission that is supposed to examine, a 9-member commission that is stacked in favor of the hospital industry. And we have a strong critique of this, and you can go on our website and look at it. This commission, which has yet to be appointed, it was supposed to have been appointed a year ago, is supposed to look at VA facilities around the country and decide which are to be improved, closed, consolidated, or repurposed. It is essentially like a base closing, like the BRAC. They assemble a list that is sent to the president and has to be voted up or down by Congress. Now, the commission, I think, is going to be announced in March, and the secretary, Dennis McDonough, is going to make recommendations, which are going to be published in the Federal Register, on what facilities what is going to happen to what facilities. The Air Commission mandated market assessments. Thank you, Sam. I have 2 minutes to get this out in. The Air Commission mandated that the VA conduct market assessments looking at the capacity of the VA in the private sector to handle veteran patients. These market assessments are a total joke. We will, if you look on the VHPI website, and Marilyn will talk more about this, the market assessments were done with, they have old data from 2015 to 18, pre-COVID. So the American healthcare system is not the same, and neither is the VA since COVID. And most disturbingly, in the assumptions that guide the research that they did, they hired consultants. And the research was extremely shoddy, and even Dennis McDonough, the secretary, acknowledged this. It's old data that's shoddy. And in the acknowledgements of the market assessments, it says when they looked at private sector capacity, because if you close a VA, you need to see if the private sector can absorb these patients. They only considered, I'm going to take 2 minutes, if you'll forgive me, probably 2 more minutes, and then I'll stop. But they only considered physical reporting of the private sector capacity. In other words, they looked at how many psychiatrists are in San Francisco, how many ERs are there, how many primary care practices. They didn't look at whether these practices had the capacity to absorb VA patients, how long it would take them to get up to speed to handle VA patients, or whether they would accept the payments rates that the VA offers to take care of those patients. So let me just give you a quick example. In New York City, you could have 1,000 psychiatrists, but 49% of American psychiatrists won't take any insurance whatsoever. So if you have 1,000 psychiatrists, you really only have 500. And of those 500, it's not clear that they'll accept, you know, VA payment rates, which are lower than private insurance payment rates. There's so many questions they didn't ask. It's kind of a joke. I mean, one person in the VA told me that they went around and they looked at whether parking was more convenient or not, or whether parking lots were full. That is not how you choose a doctor, you know, whether parking is available. I mean, it's almost like a Saturday Night Live skit. So we have to be prepared for fighting these proposals for what we believe will be significant closures of programs and facilities. I think they would like to get rid of all their inpatient care and just have a bunch of giant CBUCs. There's no discussion of what's available in rural America. One could go on, and I would encourage you all to come on to our Zoom on March 3rd at VHPI, and we're going to have a discussion about rural veterans. The final thing I want to mention is the human resource management modernization, human resources modernization plan that was launched under Trump, which has created total havoc in the VA. They've moved human resources out of local VAs, taken the offices into the VISN. They have a web-based system. Nobody is accountable to the medical director anymore. And they've created a disaster in hiring. You have a group that will be discussing this. Congress is aware of some of the problems, but we need to make people aware of many more. And I want to end now. Does anybody have any brief questions before Marilyn starts to talk? I don't know how we're doing this. I have trouble with paying attention to the chat and talking. So if folks could raise their hands.
People raising hands in the Zoom? They could do it.
You can do that by, isn't there a raising?
There's a little hand in the Zoom, but it's one way to raise your hand.
Who?
Reactions, isn't that how you raise your hand? Under reactions, it says raise your hand at the bottom of all these other happy faces and sad faces.
Yeah.
Or I can see your videos. If you just want to literally raise your hand, I can.
Dan? Dan, you're muted.
Yes, I'm muted. Thank you. Excellent presentation. One of the things that not even mentioned here in this is one of the problems I've been having is actually them outsourcing our evaluations to get our benefits and compensation.
Yes.
And even as I've complained all the way up to the Inspector General, they seem to do nothing. It's almost as though it's required. And I don't trust them at all.
Yes, and I didn't even go there. The VBA is a whole other can of worms. Marilyn can mention that. They have outsourced comp and pen exams. It's a disaster. There's so many disasters, you know, that, I mean, one would have had to go on and on. And all I can say, Dan, is we just have to keep putting the pressure on, which is why we're doing this today. But yes, that is a very significant problem and part of the privatization. Marilyn, do you want to say anything about that?
I just want to say, absolutely. I think members of the Senate and House Veterans Affairs Committees need to hear from you, because it's really budget driven and politically driven. They just want to take that capacity outside of the VA healthcare system and give it to the benefit system so they can completely contract it out. They've given them the authority to virtually do that. So I think it's great you've started to fight it. And I think the more someone who actually experienced it tells the Senate and House Veterans Affairs Committee that resources need to be shifted back to the VA so they can do those exams and do them better would be a wonderful thing.
Is Doc are you Dwayne? Whoever, yes. Hi.
Thanks for calling on me. Yeah, I'm Dwayne Doc. And I find that one of the reasons that okay, I live in Harmony, Minnesota, don't you know, about 40, 50 miles west of La Crosse, and my CBOC is in La Crosse, and I'm going to for example, simple procedures like colonoscopy is not super simple. However, we don't have anybody close by that I told them I'd be willing to drive to Minneapolis, St. Paul, to the hospital up there, or Iowa City, and they wouldn't accept that, and told me that I was more or less required to have a private sector community care or corporate care type of thing. Now I went to a hospital that's 40 miles away for my colonoscopy. The last time I did that, the colonoscopy got paid by the corporate care or community care, whatever you want to call it thing. However, when they sent my labs out, the lab people sent it to the VA to be billed instead of corporate care to be billed. And I ended up going into collection because I didn't have $500 to pay off for my laboratories work done. And my credit rating plummeted from 800 down to 500 overnight. And so having these procedures, hopefully within the VA to be used would be a good thing for us. For example, I got to drive all the way to Madison to have a VA thing, or the Twin Cities, 200 miles either way, and I don't mind doing that. However, the vision doesn't want to be saddled with that, so they send me to corporate care. Thanks for your listening.
Yeah, I think that we have to start writing op-eds, and I mean, one of the things that, and I will reach out to you, Doc. I mean, this would be a great story to be on our VHPI website. And I think that, you know, you're supposed to have choice. I mean, that's outrageous. And why that's not a choice. If you say, I want to go to the VA and they say, sorry, have you talked to your congressman about this? Hello? You're on mute. You're on mute.
I'm sorry. Jim Hagedorn just died night before last. And I have contacted his office with written letters and then DAV group texts and stuff, and he's responded. I've even called his office several times with proper instructions from people like Jeff Roy and Leslie Buzz Davis in Tucson and stuff like that. I've worked with these guys, and I get mostly what I get from people like him and Ron Kind in Wisconsin was sorry, we're doing the best we can do, yada yada yada.
Sure.
Bull feathers.
Okay. Yeah. Well, we can take these kind of things offline, but yes, Harvey, you need to unmute.
Okay. I was looking at the fast facts and the points that you made, which are all so important to make to our representatives, but one that's not there that I think would be very important and help explain the cost benefit is the VA's ability to negotiate drug prices, which as we all know, no other entity has.
Thank you for mentioning that.
And I had a personal experience of that. I was just put on a blood thinner, Eliquis, for atrial fibrillation. My Part D Cigna Medicare coverage, the copay is $80 a month. The VA was $11.
That is great. That is great. We need those kind of testimonials. I didn't even mention the fact that the 20% of the VA budget is now going to paying for corporate care. So it's cannibalizing the VA budget. The corporate care, the share of going between 2017 to 2021 has increased by something like 200 to 500%. You get different.
Yeah, about 25.
Okay, so this is just giving you a taste. I mean, I am available to anybody who would like to talk. We'd really love to get these kind of anecdotes down. But I really want to pass the baton on to Marilyn Park, who is just like, we are so lucky to have Marilyn here. I am so lucky to have her as my friend and colleague. Marilyn is going to introduce herself, and she's like the ace lobbyist, Marilyn. You know, I pretend like I know what I'm doing, and because Marilyn teaches me. So with no further ado, let me introduce Marilyn Park to you.
Thank you, Suzanne. I treasure Suzanne's collegiality and friendship equally. So, okay, it's so nice to see everybody. Just because you were talking about various reports of yours, and once again, as somebody who's spent 16 years plus representing people who work at the VA as an American Federation of Government Employees lobbyist, I have learned for 16 years what I've just been learning again today, which is the best lobbying tool to listening to all of you who use the VA or work at the VA or both. So in your example of your reaching out to your representative or to the IG, I believe that this is not a bad idea too. And then I would like to stick to mainly tips, although I'm happy to address issues. If you go to the House Committee on Veterans Affairs website called veterans.house.gov, I think it's worth it. I think they would do something with it. It just says, contact the committee. Do you have any concerns? And then you would literally just fill out a short little questionnaire of who you are, how to reach you, and then your comment. So I would say every time you have an example of a bill collector going after you, or an exam that went bad, or any other step direct experience, there are actually a lot of staffers in the subcommittees there who would be looking at this. I wouldn't just do this, but this isn't a bad resource. So I want to just recommend going to veterans.house.gov and then contact the committee and use that as one of the many ways to record your experiences that are so valuable. So I'd like to focus my time on basically lobbying tips. I know some of you have been on the Hill before, so I try to make this general. And so I'd like to call this 10 commandments of lobbying, or mistakes I don't want to make again, meaning I've made them too. And when I take my members to the Hill, they make them, and it's all natural. So some of you, if you have any funny stories, either raise your hand or put it in the chat room, because, you know, we all learn from our mistakes. So I really would love to hear it. And then again, if there are anything, Suzanne has done such an incredible review of the big issues. And I'm just going to agree more with every way that you describe what we have to fight. And I love fighting them with Suzanne and with all of you now. So I want to say that the things I'm going to discuss in this lobbying tips session, I will also put in writing, and adding any comments you all add today to the list, along with some resources that I think are useful for checking in with regularly, websites and Twitter accounts and things, just to keep you attuned to what's going on. So, okay, let's start. You're going to come to the Hill soon, and you have things you want to ask for. And so let's assume the first thing you want to ask for is for them to please support a bill. Well, the first thing you need to do is make sure, go into their record. You need to look into their record. Are they on the bill already? I've gone into offices and said, will you please sign the bill? We already did, like bloody bugging. And then maybe see who else that they work with may have been on the bill. Like you like to say, well, if you haven't joined the bill, did you know that 3 members of your state delegation are on, the other members from Minnesota are on the bill? So that's also very important. The next thing is to see, look at their regular record. What are they, what else are they on? What other veterans bills you could see? Like you're asking them to support, you know, a lot more money for healthcare. Maybe you can see that they already have it, you know, they're already very committed to mental health care or something. So the 2 places, again, some of you may be very aware of this, are congress.gov, where you can check a bill, look and put a bill number in and see who's on the bill already and what the status of the bill is, which I'll get to next. And also you can go to GovTrack, which is excellent. I was just on it myself again, going, my gosh, what a fabulous resource that is. GovTrack US, I believe it is. And again, I will put this, don't worry, I will put this all in, is unbelievable. It tells you by name of each person on the Hill, what bills they've co-sponsored, what bills they've won, what bills they've been bipartisan with. It's an incredible tool. So I just think this is all part of your research before you go to the Hill, so that your meeting is productive, because you may find out they're already on the bill, or you may find out by looking, again, you can look at these technical sites to see what's happened to specific bills and then also important, go on to their personal website, tester.senate.gov or klobuchar.senate.gov, wherever you are, and just read what the heck's going on with this person recently. Like, what are the issues they say they stand for? Am I going to have a chance with this bill? Are they saying that right now burn pit's their top priority, or they're whatever? Or also you find out some things you could say nice to them during the meeting, like, oh my gosh, I didn't know you just got the top award from the VFW on doing something for veterans. So there's just a million reasons to check the bills that they've been doing, make sure you're accurate in your ask, and also to check what's going on with them. Put my glasses on here. Another mistake you could make, I've made, is to say, so let's say the bill is, as you know, a bill starts and it gets introduced. But the first people to look at a bill gets assigned to committee. So if it's a veterans healthcare bill, it's going to get assigned to, on the House side, House Veterans Affairs or Senate Veterans Affairs. So the first vote is going to be in the committee. So let's say you go to see a member of Congress who's on the Senate Veterans Affairs Committee, and you ask them to please, when the committee meets, to please vote for the bill. Come to find out, the committee already voted on the bill and voted for it, and it's heading now for the full Senate. So like, that's another gaffe. You know, I didn't know, my gosh, I'm behind. The bill's already moved out of committee, and they don't have a chance to vote for it in committee, or if they already voted in for committee, that means when it goes to the full Senate, they're going to vote again. So just catching up on where the bill is, where they are on the bill, where their friends are on the bill, and what else is going on in their lives that might be good for greasing the wheels during the meeting. Also, like I said, if they've been honored by some veterans group or some other important group, you get to, thank them for all the good things they're doing. So very quickly, I just went on, Senator Tester, as you know, is the chair of the Senate Veterans Affairs Committee from Montana. So I just went on his regular personal site, tester.senate.gov. And in the last 3 days before this session today, they had the Senate pass their burn pit bill unanimously. That's an accomplishment. The day before, the Fleet Reserve Association gave him his top honor. And earlier, they just got recognized for the reauthorization of the Violence Against Women's Act, which is not veteran per se. So I'm saying, in just one quick look before this session, I saw that there were 4 different things you might want to mention to Tester before you even go see him. So that's it's so important to prepare. But what is the next thing you need to do to prepare for a meeting? The main thing that's practical is a one-pager, a leave behind, we call it. And one of the reasons you have to have a leave behind is, I think of it like when you go on a plane and you have to take your a small bag on the plane in case they lose your luggage. You might not get that meeting. You might not get the 20 minutes you expected. You might not get to see the senator you wanted to see because he got called away for a vote, or she did. You may see a staffer who has got 5 minutes for you and standing out in the hall because of some crisis is always erupting. So use that piece of paper as insurance to everything you want to say. So and the other thing it does is, if you put on that piece of paper, not only the ask and your arguments for what you want them to do, but also who you are, what your group is, and how to reach you. You don't have to waste time in the meeting introducing yourselves and how to find you. So that one pager is very valuable for just summing up why you're there and who you are. And let's see, what else would you want there? It might not be bad to put on the bill. Like if you say, I want you to support this bill, and you can put at the bottom, other veterans groups that we work with on this bill who support it are also, just so it's all there in one thing, because the staffer you see in that 5-minute meeting or 15-minute slower meeting, it may not even be the one who ends up handling it. It may be handed off. You can have a defense fellow handling one veterans issue and a VA fellow handling another, and you just don't know who's going to end up needing that piece of paper. So And so that's it. I'm going to say something really obvious. I know I need it. Be on time. I don't know how many of you are going to try to get personal meetings during this crazy pandemic period we're in, but it is apparently, I haven't gone back to the Hill. It is really hard to get in there. And so you've got to build in a lot of delay time to make sure you're there on time. And it's harder than it seems, especially now. And I've rushed to too many meetings where I was out of breath and lost a few minutes of a very precious short meeting. So as I said, you could possibly expect to be disappointed, expect to see somebody who could care less, is thinking about lunch and needs the piece of paper for that reason, and will need your follow-up, which I'll get to next. Expect, like I said, to be standing out in the hall when you thought you were going to have a nice sit-down meeting with shaking hands and looking around at the beautiful things on the wall. It doesn't always happen. And the other thing is, if the meeting's short, or as Suzanne said, if you don't want to get angry during the meeting, if either the staffer says something alienating or the member of Congress says something exactly opposite of where you want them to be, smile, thank you, and you can follow up in other ways, and we can help you on other ways to get around the bad news. Suzanne mentioned something right before the session. What if instead of the meeting being too short, which you can take care of with the one pager and with a follow-up email later, what if you run out of time? What if he says, oh, great, I just signed that this morning. Maybe it wasn't a mistake, but even if you go on these special sites, which I'll put in the list, you're not going to note that a bill that somebody just decided to vote for co-sponsor a bill that morning. So it might not be fresh. They could say, oh yeah, I just did it this morning, or I just told the office I would do it. So now what are you going to do? So, one thing that you always do during your meetings is say, what can we help you with? What are you working on? Can we do anything in the community for, back home for you? Do you want to talk to more of our veterans? Do you want to hear more reports about what we're experiencing as veterans trying to get comp pen exams or being forced into community care? What can we do for you? And then the other thing is, they all need to get reelected. So if you can think of something to invite them to back home, when they're back in the district during recess, and say, we're having our monthly meeting, and if you could just join us for a few minutes, our members would love to hear from you. Invite them to do something. So those are really the things to do during the meeting. And I'd say, expect to be time efficient, keep the ask simple, use the leave behind paper as your backup, and all that. So that's most important. And then I'm going to wrap up with what you do after the meeting. Okay, let me see if there's anything else during the meeting that I think is a hot tip. Oh, all right. So we've been talking as if you're asking them to sign on to a bill that's already been introduced, right? What if you're in the meeting and you want them to do oversight of the example Suzanne talked about, like this horrible mess with HR reorganization, which is making it impossible to hire people that we need to deliver healthcare. Or there's some question about mismanagement of money, like the problem with the bill collection stuff. That's been going on a while. It's terrible that veterans' credit ratings are being impacted by a horrible corporate care, bureaucracy mess up, and VA not paying them on time, not paying the providers. So the question is, you're coming in and saying, I want you to do oversight. Well, oversight means I want you to hold a hearing, to call people to the table and ask them why they messed up and what they're going to do better. It means maybe they want to request a study from one of their independent groups, like the Government Accountability Office or Congressional Research Service or the Office of the Inspector General. So the first thing you want to ask is, what if there's already been some studies? So you don't want to ask them to do a study about something that's already been done. So I'll put this in the follow-up memo, but the places you want to look to see if studies were already done, or there may be studies that would be helpful to shape the next study, but you want to see that. And also, if you can look on the Veterans Affairs Committee sites or Senate and House to see if they have oversight hearings already. What if they just had one last month on this issue? That would change the way you ask for oversight. You could thank them for that hearing and then see what else they could do for it. One other thing that's very efficient when you get to the meeting is make sure at the end you get the business cards for the staffers that you need to talk to. There could be more than one. It could be the one in the room, or you could say, who should we be following up with? And, in the front desk, they have all the different cards. It's really important because then you have all the names to send them follow-up emails. Those are really the obvious things. And then when you get back home, obviously, like anything in life, thank you very much for the meeting. Here's the one pager and any of the documents attached here that we talked to you about. And just restate again, thank you again for considering our ask again on Bill 1234. And again, remember on March 15th, we're having a monthly meeting of our organization. And so that's that. I see a nice question here from Mike Marceau. Could we as senators and reps to send a dear colleague letter? Absolutely. I don't have the full question. I think it's in the chat. To support other bills. Absolutely. You could say, you've been a leader on this bill. Can you send a dear colleague? Thank you for your leadership on the burn pit bill. We need more people on it. Could you please send it? That's a great, dear colleague is a wonderful tool. Thank you for helping mention. So now that I've talked a lot, I'd like to know if anybody has some fun war stories for me, because I haven't used up my time. Anybody gone to the Hill and have a helpful tip for the rest of us, or something you learned from by doing it wrong, which is how I often learn. I leave the floor open.
Marilyn, you're about 6 minutes over time.
Okay, well, if no one has any else to say to add to this, or you want to put it in the chat, I will add it to what I hand out at the after the meeting. Thank you, guys.
I just want to add to that, that one of the things you can do is that there are subcommittees of the Senate and House Veterans Affairs Committee. So if you go on the website and you look at subcommittees, you'll discover that certain people are, you know, like Pappas heads oversight and investigations, Levin is economic opportunity, Mervyn is technology. So it helps to know, you know, who does what. And you can kind of connect health to all of these things, because if the HR modernization is screwing up the ability to hire, so that's something that's helpful. I mean, I would like to take a privilege and ask, are there any questions for Marilyn? Because I do think we could take a couple of questions even if we're over time. Cara?
Thank you, Suzanne. Just a question, an observation that our particular representative, Ann Kirkpatrick, is rumored, I think it's more than a rumor, that not going to be running the next election period. So she is in a lame duck period, so to speak. How can we use that effectively to suggest that she has no,
Right.
you know, how can we use it effectively?
And my quick answer is ask her to stick her neck out more, exactly what you said, right? Things you know she'd have been afraid to do politically before, this is the time to ask her. And then the other thing is to exploit the fact that everyone is leaving the Hill wants a legacy, right? We'd love you to leave the Hill knowing that you were the leader on X. Would you please be that person, you know? I mean, that's a great, I think you already, you know, identified a great opportunity there, so great. But that's how I would use it, Suzanne.
Yeah, I think that's absolutely right. And also, you know, maybe you could comment on this. I know I'm taking a little time, but, you know, there's a lot of bills out there that are introduced that are kind of, how would you call them, Marilyn? I don't know, you call them garbage bills, or, you know, people.
But message bills.
Message bills, and also just get your name on a bill, you know, I mean.
Right, bills you can go home and said, look what I did for veterans, when it's just a stupid, just a useless bill. But
Yeah.
you get quantity over quality.
Right. Do you want to talk about, just give a minute about message bills?
Well, I certainly wouldn't, I mean, I guess what that makes me think of is you only have so many asks in this world. You only have so many bites at the apple. I would try to ask for bills that you're likely to get traction on, that are likely to move. Does that make sense? Like, this is awful, but like, I'm trying to think of something that's in our union world. There are some bills we like. Just try to fix something for the unions that we've been asking for 20 years. So I try not to take up much time asking for bills that have had have not had a lot of success because everybody wants to win and we only have so many asks. So that's my thing, but I don't know. That's all I want to say. Message bills, other than I don't put a lot of time into them unless, if they, put it this way, they have no trouble finding message bills themselves. So I don't think they need true advocates to ask for message bills. That's my opinion.
Okay, so we're probably running behind, but hopefully that's all right. So what we're gonna do now, except I have to go to the bathroom, which will take me 2 seconds. Maybe Marilyn, you can fill up the space with something.
Well, just so you're about to go into groups where I believe you're either asking for a bill or trying to stop a bad bill or asking for oversight. Samantha and the executive board, does that sound right? Those are the summary of the 3 types of groups people are going to be doing. So obviously when you go to a meeting, I think I talked the most about asking someone to support a bill, sign on. A version of that is asking them to introduce a bill. As Kara just said, you might take somebody who's leaving the hill and ask her to do something really bold, like introduce her own bill for something and be identified with that. So you could ask somebody to introduce a bill. That's a whole new idea. And when you ask somebody to oppose a bill, in the early stages, you're basically asking them not to sign on, not to co-sponsor a bill that's already been introduced. You don't want the numbers to support to light up, but you might also ask them for something really big, which is when a bill moves to the floor for a full vote of the House or Senate, you might be asking them to take the really bold move of putting a hold on the bill so that it can't move it can't move unanimously, because otherwise they will try to push the bill by voice vote. But if one person has asked to place a hold on the bill or objected to it, it's a different word in the House and Senate. That's another way to ask someone not to support a bill. So that's it. And I think with oversight, we covered it. So, okay, Susan, I just elaborate a little bit on different ways, different asks you can have regarding a bill you like or don't like. And we could talk about this in the groups more too, in case this was a lot of rushed information. What?
Now, what we're gonna do is we're gonna do a role play. Marilyn is gonna morph. Imagine, some kind of, imagine some sort of, thank you.
I was just thinking of something funny I could do, because I'm gonna tell them who I'm gonna be. I'm just gonna realize I have a Stetson in the other room I could put on my head.
Oh, go.
Again? Okay.
Yeah. Just, all right, this is gonna be great. Marilyn will return in her new incarnation. We're having reincarnation before you die. It's a kind of a new thing we've developed. Okay, Marilyn.
How's that? It's not mine, so let's see how it looks. Not bad?
Yeah.
Better than nothing.
Love it. Okay, Marilyn is going to be Senator John Tester, a Democrat who might as well be a Republican and has really been a champion of privatization, even though he claims that it isn't. And actually, I didn't mention this, and I think it's worth mentioning. They will say, one of the things we suggest that people do not do is say, Senator Tester, we want you to oppose privatization. And Senator Tester will say,
I hate privatization. I don't believe in it and I don't do it.
Right. And Senator Tester is able to do that because he defines privatization as one thing at the end of what is really a spectrum of activities, and that is closing down the VA entirely, selling it off to the private sector, and moving on. Privatization is, in fact, a range of activities, a spectrum of activities, and what they're doing in the VA is not outright contracting out. It's not like, giving your local garbage service to a private contractor. What they are doing is it's what we call death by 1,000 cuts, or the salami strategy. So we encourage you, when you talk to these folks, not to say, we want you to oppose privatization. but we want you to oppose outsourcing of VA care. And we are for insourcing of care, expanding VAs. If you have an underutilized VA, why not look at how, it can be expanded by bringing in veterans with bad papers, high incomes, no proven service-connected disability, community members, fourth mission, et cetera. I forgot to mention that because I wouldn't go in there and say, please oppose privatization, because the worst privatizers, even on the Republican side, the Koch brothers are against
We all
privatization.
love the VA.
We
And in
love-
fact, Suzanne, you were mentioning, more and more CBOCs and outpatient clinics. Well, one thing we've seen over the years, going back to the Bush days of privatization, was, yes, you have an outpatient clinic. It's called the VA outpatient clinic, but it's run by a contractor. And then what they decided to do was say, you don't need inpatient hospitals. We'll build giant super clinics for you, but they'll no longer be linked to a VA hospital. If you use that outpatient clinic, you will be reporting to a hospital down the road. And so it's part of what Suzanne's saying along the incremental stage of this. The less and less the link is back to the VA medical center as the mothership, as the hub, the more privatizing it is. And there are many different ways that they try to de-link the VA from the coordination and delivery of your care. Yet it doesn't look like full-blown privatization. And, Suzanne, I have to say one of my favorite trainings Suzanne did for our members was talking about, this is what looks like privatization and this looks like privatization. It isn't so obvious. So I just.
Right. Yeah, and I think that's what's going to come down with the Air Commission is that they're going to want giant CBOCs. Well, what happens to your residential program for PTSD?
Right.
What happens to your nursing home, your community living center? What happens to your research? What happens to your teaching?
Training.
What happens to your fourth mission and the ICUs that are going to be needed during a pandemic? I mean, Okay.
And then where's the VA during the next pandemic and the next
right.
hurricane? Right.
Or, by the way, in case anybody's noticed, we're now talking about going to war with Russia. So if the veteran population is going to go down, really? I mean, the United States, as you all know, in Veterans for Peace has never faced a situation. I mean, it's been how long where we've always had some kind of war. So if you think there's not going to be more vets who need care. Anyway, so I've made an appointment with Senator Tester here, and I want to talk to him about outsourcing of care and, the failure to have quality standards applying to VA, non-VA providers. And so I just have a very few minutes with the senator. He's kind of a busy guy. So, we're going to meet. So, and I will introduce myself. Senator Tester, thank you so much for making time for me. I'm an Iraq veteran. I was deployed 3 or 4 times to Iraq, and I have just so many problems. I have burn pit related asthma. I have PTSD, MST, military sexual trauma. I was actually assaulted by a senior officer. I have a lot of chronic pain, musculoskeletal pain, and I have gotten really great coordinated care at the VA, and I go to a special women's clinic in Billings. And, I'm really concerned about the fact that so many of us veterans, and this has happened to me and my friends, are being sent to private sector providers. And our experience, my experience is really been very disturbing. I wanted to see a dermatologist in the VA in Billings, and they told me I was 40-day wait. I said I'd be happy to wait that long. And I was told that I couldn't, that I had to go to a private sector provider, and the wait was 8 months. I've talked to a psychologist. Once again, I wanted to wait for the VA, and I was told that the wait was too long, and it took me 3 months to get a telehealth appointment in the private sector. And the person that I talked to didn't know what I was talking about. I mentioned a DD 214, and they had no idea. They didn't know anything about the military. And they just, anyway, I'm really concerned about this, and it doesn't seem like there are any standards imposed on these private sector providers. They don't know anything about pets. I mean, Senator Chester, what are you going to do about this? I mean, you sponsored the John Hannon Act, you sponsored the Mission Act. I'm just very disturbed about all this, and I'd really like to know what your plans are.
Well, you know, and I remember seeing you at that picnic last summer, and I'm very glad to see you again. You know that Montana has no better friend. Veterans have no better friend in Montana than me. I have passed so much legislation to make sure the healthcare is there for you. And I obviously, almost all our veterans have to, we don't want veterans to have to travel 4 hours for a simple exam. And that's why I'm so proud that I have tried to make the community care network work better. I want to make sure that those providers get paid on time. I'm the one that got one of the first the contractors called HealthNet kicked out of the program because they don't pay our providers on time. So my focus has been to make sure that in Montana, which is our wonderful rural state, that the private contract care is run properly. And I want to make sure you get better care when you go out in the community, because most veterans in Montana want the choice of going out there and not having to drive 3 hours to the VA. Now, to the extent that you said to me that you actually wanted to go wait for the VA person, I'd like you to talk to my staffer, John Wagner, in the district office about that, because you know he's our best veteran constituent person about that, and have him go back to the VA community care office and find out why you weren't given the real choice. Because I do believe in choice, but I think choice is a wonderful thing. And I just want to make sure every veteran in Montana can see a doctor.
So I want to know very specifically, Senator Tester, if you will support the, the Team Competence Act, which was taken out of the bills that were proposed in the Strong and the Mental Health Care Act. I'm really concerned that there are no requirements imposed on private sector providers, to abide by the rigorous standards that are imposed on VA providers in regards to the kind of problems, that I have and that my fellow veterans have. I mean, I don't know what you're hearing, Senator, but people are not happy about what they're experiencing in the private sector. There are long wait times. They don't seem to have any standards imposed on private sector providers. And, I'm very disturbed that they don't often offer like gold standard treatments for PTSD, like prolonged exposure therapy and cognitive processing therapy. And I don't understand how come, we get one standard of care that's very high at the VA and we get no standard of care in the community. What are you?
I couldn't agree with you more. I want every veteran in Montana to get the same care, whether they end up in the community or they end up in the VA. I believe that the work we're doing now to apply voluntary standards to them are going to be adequate, because I believe we'll be able to have enough oversight. I couldn't agree with you more that they need to be held to a certain standard. And I think the bill you're mentioning is one I would be happy to support. Do you know of any other veterans, which of the veterans groups are behind that bill? Because I know it's relatively new. I know you're a veteran.
Many of them are. I think many of
great.
those are, and I don't think voluntary standards are enough. We have decades of history of the failure of voluntary standards. There's a literature on this. I mean, I don't usually do this in my spare time, but I have read some of the literature on this. And I think we have to, we don't impose voluntary standards on people in the VA. We don't say, if you feel like doing suicide prevention training, it's up to you. So why is it up to folks in the private sector? I mean, look, let's face it, Senator Tester, we know that, the average, I'm making this up, okay, so sorry. The average patient panel of a psychologist is like 2,100 patients. And, or all right, I won't make this up. The average patient panel of a primary care provider is 2,100 patients, and of those, maybe they may have 10 or 20 veterans. It doesn't make any financial sense or even clinical sense for them to spend a lot of time getting up to speed on vets if it's only for 10 patients. But if they're required to do it in order to participate, they will. So you explain to me what will, I mean, you say voluntary standards will work. Help me understand what incentive these providers have to take the time to learn how to take care of me. What incentive do they have?
Well, I believe that the providers we arrange for contract care within the community are just as dedicated as the doctors and nurses in the VA. And we make sure to give preference to those who have shown us a commitment to veterans in the past. And it's built into the laws we have that you have to give preference to those who have shown in their application a track record for caring for veterans. So I'll tell you what, we will do some oversight on these concerns you've mentioned. Because right now, the way the law is written, the standards are voluntary, but I do think that the team bill would give them training, right? And more competence. Is that
very minimal training? But Senator Tester, we have literature. The RAND Corporation did a study of private sector providers in New York State, the 5th largest veteran population in the country. They surveyed thousands of private sector providers. They all said they were committed to veterans. They all said they wanted to help veterans and do their bit. And then they also said that they knew nothing about veterans, most of them. The RAND Corporation established very rigorous criteria to assess competence and capacity to care for veterans, Senator Tester. And only 2% of these providers met that criteria. 2%. And, you know, and they said that they knew nothing. The vast majority said they knew nothing about veterans. And the vast majority, when asked if they would want to learn voluntarily, said no, they were not interested.
What would you think if I found somebody from University of Montana? I could contract with them to do some training for people who are in the community care network. Do you think some training run by one of my favorite contractors might be a good solution to some of this?
Would the training be required, Senator?
Well, maybe if they volunteer to take it, you know, they'll get more priority next time for the business. But I just have some friends over at the university that I would love to give them a, you know, contract. That might be something we could work on together. And again, I hope you will talk to John Wagner about anything that's happening to you. You said you use the women's clinic. Are you pleased with that? I know that women's clinic has been expanded a lot over the years, and many women veterans tell me they're very pleased to have separate facilities for women in the VA. Is that something we should be expanding more?
Yes, I think you should be expanding the women's clinic, and I also think you should be requiring private sector providers to know more about women veterans, because, you know,
Absolutely.
sometimes you can't get certain kinds of services in the women's clinic. Senator, I really understand your commitment to veterans, and you know, I believe that you are committed to veterans. I'm not happy with some of the stances you have taken. And I think if you really want to make sure that people like us get good care, that we need to require private sector providers to abide by the same rules and regulations and standards of the VA. And I would encourage you to think more about that. I know you're concerned about access, and that if people if we require them to, you know, to get training, that they will not be in the program. I think that access to harmful care is sometimes worse than no care at all. I have a friend who went to a hospital and got surgery from an incompetent physician and almost died. And if that person had driven, you know, 4 hours to it would have been worth the drive to not go through what she went through. You know, so not all care is good care.
Well, you know, I wish I could tell, I'm very proud of the VA, but you know, we have a lot of problems staffing it. And we have tried and tried to get people to come work at the VA in Helena and in Billings, and it's really hard to get people to come to rural areas. And I think our veterans have to get the care as long as we still have these shortages. The whole country has physician shortages and nursing shortages. So, you know, we've had to close a number of beds in our VAs because we don't have enough nurses at the bedside. We offer incentives. I mean, I've heard VA is top notch when it comes to human resources things. We give them all the tools in the world. So I don't know why. It must be that there's just too much of a shortage. We can't get people to come to the VA, and then this turnover, they don't want to stay there. So I don't know what's going on there, because we have given the VA all the hiring and recruitment and retention tools that anyone could have. So I don't know what we can do to make the VA better on the
Well,
human
I mean,
resources
one
side.
of the things that you could do in the Senate is pass the bill in the House that will give nurses and physicians better pay. You know, I know for a fact that the hiring has been made worse by the Trump-initiated human resources modernization.
Yeah, I've heard that's a mess. I haven't really looked into it. Tell me a little about it.
Well, there was a,
I was going to be brief with my staff on it because there was some memo that went around, but
yes, the chief.
I'm having I think they set up a briefing with the secretary for next week. So
Well, I
please
would
fill me
hope
in.
you would have hearings on this because it is a disaster. And the chiefs of staff of 101 VAs were participated in a
Yes, I
survey
heard. Mhm.
and said that modernization has made things worse and not worse. One actually said this is an existential threat to the VA. There's all kinds of things that can be done to deal with cumbersome hiring processes. You have to be able to pay market rate salaries everywhere and also connect to rural programs that are trying to produce more rural doctors. You know, I personally think that, you know, Congress needs to deal with graduate medical education and insist that that medical schools, that, I mean, hospitals and medical schools that get graduate medical education money have to produce enough primary care doctors. This is not a difficult thing to solve. Other healthcare systems in other countries produce 50-50 or sometimes even 60-40, and we don't produce enough. We produce 15 to 20%.
Well, you know what I've been told, and I'm kind of leaning that way, is that in order to get all this, you know, training and recruitment and hiring, we should centralize HR more. I want to lift everything up to the VISN level. You know, I'm really proud of that director at VISN 19. We're good buds, and he tells me that he's doing more and more of the HR now, and I think it's going to work. He's got a lot more software in place to do it. You know, it's really hard to find these local HR people at the facility. They don't want to stay. They're not well trained. So I think going centralizing up to the VISN level is going to be the way to go in order to recruit and retain people.
That's not what the chiefs of staff and the medical directors and the staff in VA say all over the country. I read.
You've given them that memo to my staff. I think they need to.
I will. Yes, I will.
Thank you so much.
Thank you. So, Senator, thank you for your time, and you know, I hope we can stay in touch. I'd love to get the card or the email of the staffers that are dealing with these issues, and I'd love to come and meet with you next time and bring some more veterans with me, because we really have a lot of concerns.
Well, it's great. Look, I've got a very busy year. You know, November's just around the corner, our 2022 midterms, and I've got a lot of members of the Montana delegation in the House I got to worry about for 2022. So, you know, if you've got something where I can come and meet with you and remind your members of how much I'm there for veterans, and I can bring along some of these people who are having some tough races in 2022. You know, Montana's a tough state for some of us Dems. So please keep us in mind, because we would really appreciate some help.
Yes, thank you so much. And I just want to end by saying that, you know, if some of these issues aren't resolved, you're going to have some pretty deep scandals on your hand that make Phoenix look like it was just a little molehill, and that could really impact the Democrats' chance of retaining the House and Senate and even the presidency. Yeah. So these are serious issues.
Well, you know, one thing about me and the Senate Veterans Affairs Committee, I am very proud of my record chairing the committee, and I love my bipartisanship. I am the most bipartisan chairman in history. I work with Senator Moran from Kansas well, you know, we don't fight. We work well in bipartisanship, and I think together we're doing better for veterans than ever. So you can count on me to address any scandals and any needs, budget needs. But I do want to keep hearing from you, and I hope you'll stay in touch with my staffer, you know, Susan Smith, who is going to be handling these issues for me.
Thank you so much, Senator.
It was a pleasure to see you. Looking forward to seeing you back in Montana.
We'll be at a picnic that you're giving next Saturday.
Oh, terrific. We're going to see you then. I look forward to it. Bring all your friends. Thank you.
Okay. Thank you. All right. Marilyn, you are great as tester. So,
Did a good job, Suzanne.
thanks. Any questions?
You're the most well-informed lobbyist person that could ever walk in his office. That's for sure.
Anyway, are there any questions or before we take the break,
Or
Marilyn?
how about suggestions or critiques? We would appreciate
Yeah,
them.
please, absolutely. What did we do well? What did we do wrong? What could we have done better?
What else would you have said? What else would you suggest we have brought up, or how to handle his trying to minimize what's not so good? I see a hand up there, Kara.
Yeah, I was just wondering, when you asked for the cards, was there intentionally no follow-up, Suzanne, to make sure she put it in a chat, or if she was giving you a card, if it was an in-person visit, or to get her staff's email and contact information?
Yeah, did I leave that out? I'm sorry.
Yeah.
Well, I mean, the other thing is, I think, especially with, sorry, I'm going back to my Zoom. I think with Suzanne's incredible amount of information, you know, promising to send further information after you left, right?
Yeah, that would have been
You know,
very
You know, I
important.
have examples for you. I have been looking at some studies because I'm very wonky, and I'd like to send them to your staffer because, you know, these staffers have a million issues. You may think they know everything. They miss stuff. They need your help. They need your help. Don't worry about sending them stuff. If they have it, great. If they don't, you know, we all appreciate stuff being put in our email. So I think that would have been good because you had so much good information to share. I think Daniel has Samantha, I don't mean to be the calling. I just see a hand up in Daniel's box. So is that okay?
Yeah, of course.
All right, Daniel, looks
Yeah.
like you did the official hand up.
Yeah, I did. Well, I thought that was excellent. I don't know how I, as a veteran that is dealing with a lot of these issues, wouldn't be angry at some of the things that the senator was saying.
Yeah,
Very, very hard not to get pissed off. And I don't have the wealth of knowledge that Suzanne has, and I need to study a lot more before I go in. I can see that. I would try to keep it simpler on a specific bill or something that I have, but my real concern is the outsourcing of the VA, and to kind of stick to that, what I know. And you know, it's veterans. We didn't even mention that there are 20 to 22 suicides a day. I can't imagine when veterans go to a private sector physician who doesn't know what the hell they're doing and doesn't address the real issues that veterans are going through, that this is helpful at all. And I don't know who's doing any study about how veterans react to that and their mental health, and how many more people are committing suicide in these situations. And I think we need to do a much more work in addressing these issues. And really, if you're concerned about veterans, we need to expand the veterans healthcare system.
well, Suzanne, I turn over to you and your organization. You certainly have doing a tremendous amount of suicide prevention and mental health.
Suzanne, you're on mute.
There's a lot of.
Also, we're about a half hour behind, just as a heads up.
Yeah, sorry about that. Maybe we can cut down on the break, and also maybe go over a little more. There's a lot of studies on, it's actually, I think that the correct you know, the correct figure is 17 a day, but whatever. And the majority of those are people who do not go to the VA. You know, one of the tragedies is that they seem only to care about suicide, but there's all kinds of other things that, you know, they care about suicide and mental health, but they don't seem to care about, you know, burn pits or pain and chronic pain, the integrated chronic pain programs, which chronic pain is a risk factor for suicide, and so forth. Dan, you make a really important point. I mean, and we know that VA has reduced, the folks who get help at the VA have reduced suicide risk. I don't want to, I'm seeing David, do you want to ask a question?
Yeah, probably it's a couple of questions. Yeah, it'd be good to get them. Mhm.
Mike and Doc, let's take.
I see Mike, David, and Doc have questions, and then I guess we stop.
In that order.
Okay, hey, everyone. Two quick things. Number one, that exchange just shows the value of being prepared. Like Marilyn was saying, check out the website to see the positions of the legislatures, to see what the current status of the bill, see the co-sponsor, that kind of stuff. So kind of know what you're talking about. The other thing is, when I did this when we lobbied in person in 2019, and I also do it in my emails. I tell people that I'm a disabled Vietnam vet. I've been getting my health care at the DC VA hospital for over 20 years, and I am very satisfied. I have been to primary care, hematology, neurology, dental, eye clinic, and everybody's been very helpful and very professional about keeping their appointments on time and telling me the necessary information I need to do to help take care of myself when I don't see them. So that's my story, and I'm sticking to it. Thanks.
David?
Hi, thank you. It seems to me that one of the things that is important to bring up in lobbying Congresspeople for the VA has to do with the research issue of whether it has to do with suicides, burn pits, Agent Orange things, or the next new big thing that occurs out there. Because I had a conversation with my VA cardiologist this week about, number one, the fact that they can't track what's happening in the private community care program.
Absolutely.
They have no records. There's nothing there for them to help that veteran along the way, to be that gatekeeper. But the thing that we talked about that I think really points at the lobbying issue is, without a good, healthy VA, even though we have to fight for far too long to get things like Agent Orange or burn pits, whatever it is, covered, there is an entity there that's required to do some research and figure it out. And my cardiologist was very on board with,
Right.
that research will go away if you send us all out into the community and the VA is just paying for an insurance company. All that research goes away, and the veteran is in a lose-lose situation. None of that research will find out what's going on with them. There won't be anything to figure out that there's military sexual trauma going on for women and for men. None of that will exist without a healthy VA and the VA's research system. Thank you very much.
I have a quick, I was just going to say, after Doc talks, maybe I just want to make a quick comment. You probably do, but I know, everything.
I mean, I think one of the things one could do is say, you know, Senator Tester, Congressman Levin, whatever, whoever, you know, Chairman, you know, Congressman Boss, you know, I'm really curious how you will, if you send all these vets into the private sector, how you will get information about the next PTSD, the next burn pits, the next Agent Orange, if it's scattered, among, 785,000.
They'll promise to start collecting it, but they,
Yeah, right.
yeah, I want to say, I think if you come in there and say, I get treated at the VA for X, and the reason that they have this state-of-the-art treatment is because the VA developed it. There will be no future advancement in this area or another condition, but I'm here today because I got the kind of treatment that could only be developed through research within the VA because they had this critical base. So I think making it very real is all I
Okay,
want.
great, thank you. Doc,
But
and I think we'll take just this one last question and then we have to take a break and come back.
break
Right,
out.
in your thing, you were talking about specialization, raising the wages for VA healthcare so we can bring people in. At the same time, while we just heard that somebody else has a VA cardiologist, there ain't no VA cardiologist around my area for like 200 miles. And so I am stuck going to a cardiologist and it's still 60 miles away. That's corporate care type cardiologist. And while this particular cardiologist is okay, he still doesn't know, like we're all been talking about, doesn't know about that thing. So how can we get our representatives more on board to raise the wages for our thing and hire specialists? I'm happy to see that somebody else has a specialist in this area, but I'm just like sucking buttermilk. Thank you.
Doc, you're where again? Where are you located? So sorry.
Harmony, Minnesota. I'm about 50 miles west of La Crosse, Wisconsin, and about 60 miles south of Rochester, Minnesota.
Right. Well, I can assure you that the pay for doctors is quite arbitrary in the VA. Some do well, usually the management docs. We represent the rank and file, and it's very discretionary. They'll tell you they don't have money for your raise if they don't want to give it to you, but they have money for their friends who don't touch patients. It's very, very frustrating. And there is a very big pay gap between the VA and other specialties outside. It's a real challenge, but they could definitely do better within the VA if they had a much more accountable system and a fairer system for paying doctors. And so it's a combination of dealing with the shortage, but also the fact that the VA doesn't even use the tools it has. Believe me, they could do much better in their recruitment and retention tools to get good.
Yeah.
I gotta seriously ask our brothers and sisters to keep on putting those op-eds out then so people are aware of the discrepancy in the system. Thanks.
Yeah, and I would encourage you, Doc, to come to the Rural Health Zoom, that we're doing on March 3rd. I think we have to really take our break. You've all been great. We've been here for close to 2 hours. And let's take a stretch, come back in 15 minutes. And I think that, we can move pretty expeditiously into the breakouts. I don't think we need 15 minutes. And we may go over, I don't know how people feel about it if we go over for 15 minutes, but whatever. So let's take a break and we'll see you back in 15 minutes. So what you will do, and you've been assigned to a group that's going to either be asking them to oppose legislation, sponsor legislation, or get more oversight. And you each have, a document explaining the issues. So we're asking you to strategize about, you're going to meet with a congressperson, let's just say, or a senator, it doesn't matter, about this issue. It's kind of going to be like, and then Marilyn and I will role play it with you when we all come back, so you'll each get time to present. And Marilyn and I will play, the congressperson and a staffer. We will be asking you to strategize in your session about, okay, how are you going to approach this person? What might he ask you? How are you going to respond to that? What are the issues that you want to highlight, and who will be your leader and your spokesperson? So you're going to have to choose a spokesperson. And then you spend the time strategizing, deciding what your issues and concerns are, how you're going to spend the time, what arguments you're going to make, how you may want to respond to rebuttals. And then and so there will be one of you chosen to be the speaker, right? We can't have all of you speaking. In reality, when you do meet with a congressman, if you're or senator, political representative, or staffer, when you do meet with them, if you come in a group, maybe one of you will begin, but the others of you will be able to interject. But we're not going to do that here. Then we're going to come back and do the role plays with the group. So we're going to start, and let's start with A, even though you guys, and who is your spokesperson?
I'm gonna try it, and if I don't finish up, then Mr. Ulrich can pick up the slack.
Well, do you guys want to have two of you? We can make an exception and have two of you.
Sure, that'd be wonderful. Thank you.
Okay, so let's have
All
Ray
right, now,
and Doc.
and we're asking that our
Hey, why don't we start by you? Marilyn is Congressman Jones, Congressman Park, and she's on the Veterans Affairs Committee, and I'm her staffer. So why don't we start by you guys introducing yourselves.
Okay, my name's Dwayne Teschler, and I'm a veteran for peace, and we're very concerned about saving our VA and the VA system. And here's a card for you so that you can, if we don't get done, you can see why we're here and what our stance is.
And Dwayne, I'm the staffer for Congresswoman Park. Are you a veteran?
Yes, ma'am. I'm a veteran with an honorable discharge from the Vietnam era. I didn't go to Vietnam, but I'm of that era.
And do you use the VA?
I use the VA almost exclusively unless I'm outsourced for whatever reason. And I find that being outsourced, I get a lesser quality and higher discrepancy of quality using corporate-based treatment instead of using the VA that's got me, that's all connected, and all my records are kept easily accessible, and my providers know what's going on in between each different thing, whether it's mental health, blood, my cardio thing, or COPD.
Well, I'm first I want to thank you for your service and coming to Washington. I wondered if you could tell me where you get your care from. I don't know why I'm on echo because I'm not sure if I'm in two places, but anyway, I guess I was wondering.
My care comes
from what medical center do you usually use? I'm very proud of the medical centers in our state.
All right. I go to the community-based outpatient clinic for my provider. However, for procedures and stuff, I have that done through the Toma VA hospital.
Oh, sure. Yeah, Toma's. I love the medical center director there. He's a great guy. We're good friends. So we certainly share your concern. We do not want any veteran to get lesser care when they go outside the VA, but our state has a lot of rural areas, and so VA can't be everywhere all the time. But we agree with you that they should have the same standards, and I think that's what we're doing now. So tell me how we can help you, because as far as I'm concerned, we should make sure right now that everybody's getting the same standards. And I assume that what was happening, and Suzanne's my staffer, maybe she could fill me in if she's been hearing concerns about different standards. But perhaps this gentleman could tell us what he would like us to do to make sure the same standards.
Right now, HR 7504 was brought up and introduced by a woman from Rochester. And with that being said, there were only 9 other representatives that were involved with this, and it sort of took the back burner. The thing is talking
Was
about.
I on the bill? It looks like I wasn't on that bill.
No,
was I?
you aren't on the bill. And then we know how concerned you are for the quality of veterans, and we urge you to support this bill and co-sponsor this bill so that it has a better chance of
Okay, how many
being
people,
passed.
so the bill's been reintroduced? There are already a number of people on the bill?
No, that's what I'm trying to say.
I
The bill
see.
has not been reintroduced. We're asking you to reintroduce it.
I might be
and/or-
interested to have a
and-
good veterans bill on there.
And according to the best I can, with today's investigation on my part, you would be one to introduce the bill and sponsor the bill. And we would humbly ask that you would go out to your other representatives and let them know the importance of this bill. This
I
is the clinical training and evidence-based treatment in Military Culture Act.
Well, Suzanne's going to help get me up to speed on the details of the bill. So my question to you is, have you shopped it around to any other offices? Because, usually I like to introduce a bill with a couple of other original co-sponsors. Has anybody else expressed interest so far? Or am I your first ask?
You're the first on the ticket
I hope
because
you got some others on your list to visit so that perhaps you could let Suzanne know if there's some other offices that are interested in, and we'll reach out to them. And we also have some people that we could go
Like
back to some of the co-sponsors from last time to see if they're interested in joining me. But I'd love to be the lead. I'd like to be able to go home to my veterans and say that I introduced a bill like this. So
Yes, ma'am, and we have 9 other people that are on our list to approach with this and lend their support to you.
And
So I-
Representative-
we'd like to stay in touch with you. We're very interested, and can you give us your contact information and
It's on
also,
the info sheet that I gave you already.
oh, great. And then, you have our contact information. Here's my card.
Yes, ma'am, thank you.
And, any documentation you can give us or any studies or that would be really helpful for us, for the Congresswoman.
And that will be forthcoming. Should I mail it directly to Congresswoman or your email
No, I
address?
think you
Here on
should
the
mail it
card.
to me if you don't mind.
yes,
And I-
Suzanne takes care of everything for me. I'm
That's what
busy.
I
I'm
thought.
busy
Thank
worrying
you.
about the midterm elections. I got a whole, this is a busy year for us people in the House. So I'm going to be running
Well, I
around,
think
but I'll tell you, speaking of what,
Oh, hey, and Representative, my name is Raymond. I'm also here with Doc,
good to
and I'm
meet
a
you.
Navy veteran. I rely 100% on the VA. I used to work
Thank
for the
you for
VA
your
for about
service.
7 years. I left to go to another federal agency, and I'm really passionate about making sure that the VA is keeping up. So thank you for meeting with us.
We couldn't agree with you more. I'm going to do everything I can. I've got a great staffer here. Keep the VA at its best because you guys deserve the best. You earned it. You earned the best with your service. And I am so proud of the VAs in my district. Thomas does wonderful things. It had some trouble in 2014, 2015, but some things got cleaned up and I think it's a great place. I'm very glad that the problems there have been addressed. So please go out there and find some more people. And please, I don't know how many people are in your organization, or at least in my district. Do you have an idea of how many people in our district?
If I'm not mistaken, we have approximately 2,200. I could be wrong. I was
Okay.
once before.
Well, let them know how much I care about veterans and how hard I'm working for them. And that I'd like to continue to be able to serve them in Congress. And anything you can do, I'd really appreciate. I'm not really allowed to ask for fundraising here and all that, but I just ask you to
Well,
make sure when we go back home, Pete, that I have an opportunity to meet more of your members. I'd really like to do that.
Well, we meet the third Tuesday of every month, at such and such an address. And that's also on the sheet. We would welcome you to join us and see what
Sounds
we're
great.
all about.
I have staff in the district who can go to the meetings all the time. And if it's not recess and I'm back in Washington, perhaps I can join through a call or something like a weekly or monthly call so I can stay in touch with you.
Yeah,
guys.
we're also on Zoom.
Wonderful. A Zoom is great. Love getting
Well, I
this.
think, Congresswoman, we do have another meeting that I think we have to get to, but we're really thrilled that you came, and we look forward to staying in touch with you. Thank you so much.
We appreciate your time and your efforts.
Thank you.
Thank you
Namaste.
very much. Good to meet you all.
Okay, so now we're in B. Do we want to do a briefing right after each one, or do we?
Why don't we
want
see how
to-
much time we have? Because I think we're going to see some of the same lessons learned in each one.
Good idea.
Is that okay?
All right,
That's my suggestion.
great. Okay, how about B? B?
Yes. Good afternoon. I think we're Group B.
David, I'm having a very hard time
A
hearing.
little soft, David.
Is this better?
Mhm.
Can you hear me better now? Okay. Good afternoon, Congresswoman. And
Nice to meet you.
Suzanne, your staffer.
Yes, thank you. Lovely to meet you, Mr. Cooley.
And I'm a member of Veterans for Peace, and we've been working with efforts for a long time to keep our VA in a healthy state. We're particularly concerned about outsourcing, and quite specifically, we're really concerned about the outsourcing of mental health care of veterans to the private sector. And some of the, there's a myriad of reasons for our concerns. First and foremost is a trust issue. Quite frankly, veterans have a whole lot of issues around trust. They particularly are going to have more issues with trust if they think that the culture that they're going to doesn't know anything about them, doesn't really care about them, wasn't caring about them when they were out there supposedly fighting for this country. So trust.
So what would you like us to do? We couldn't agree with you more. I have, family members who need to rely on mental health, and I understand the trust issue very much. And I don't want veterans to get any less than I would fight for my own family. So my question is, how can we help you? Are you unhappy with the mental health care that you're getting outside the VA? And what can we do to help that? Is there?
Well, one of my primary concerns is the fact that 55% of the counties have no mental health care providers, period. So if you and members of Congress decide to pass a bill that provides for the outsourcing of VA healthcare, that means the likelihood that those clinics that are out there that are attached to a mental health center go away because of that outsourcing. There will be no mental health care coverage for me.
So you're saying that if we agree, first of all, I have to tell you, I have supported bills in the past, outsource VA care. So I supported the Mission Act in almost the entire Congress. So first of all, I'm going to say that I'm your senator and not your member. I cover the whole state. So what state are we talking about? I guess to say, what state are you in?
Talking about Minnesota at present.
In Minnesota. So full disclosure, as you could tell from the Mission Act, which was in 2018, there were only 5, I was one of the 92 senators that supported the Mission Act because I felt that we had something we had to do, and also gave veterans caregiver benefits, and we just felt it was a very important bill to pass. So, but you're telling me that you have concerns about a new bill on mental health. Suzanne, are you aware of the particular bills that he's?
Yeah, I think
about
there have been several bills, Senator, as you know, the John Hannon Act that has outsourcing care, and also a new bill that will outsource the care of homeless veterans and substance abuse. Mr. Cooley, I mean, one of the things that we're concerned, that we feel strongly about in this office, is the senator feels strongly about, is the fact that, VA just can't take care of certain categories of veterans. I mean, they can't take care of veterans with other than honorable discharges. They can't take care of veterans with too high incomes in priority group 7 and 8, and people who don't have service-connected disabilities. So we've got to get the care to veterans, you know, what are we going to do about that?
Well, if those categories that you put out there says that the Congresswoman, Senator, needs to get together with her colleagues and make care for all veterans available, because currently those categories that you just presented to me, they're not going to get care anywhere from the VA or elsewhere. It's not going to be covered by the government. It's going to have to come out of their own pocket. And most veterans don't have, a lot of veterans don't have the income that's going to allow them to go to private care.
So you're saying we need to change the eligibility rules? And do we need
Yes, I am.
legislation for that? Can we get this? Suzanne, well, actually, I'll ask Suzanne knows everything. She's my top person on VA. Suzanne, is this something we can get the secretary, pressure the secretary to do to change his rules? Or is this something we might need legislation for?
Yeah, they're on the issue of other than honorable discharges. I mean, I know Senator Blumenthal, with whom you're close colleagues, has
Yeah.
been very concerned about
Yes,
this.
we work together on this.
And you could work together with him, but also there is a petition that was presented in 2015 that I don't believe the secretary has taken action
But
on.
the secretary could fix part of this problem, at least I'm hearing.
Yeah, through regulation.
Because, you know, we don't have the greatest Senate now for passing a lot of things. We have a lot of gridlock, but you're saying we could pressure the secretary to use his authority to let in more other than honorables into the.
Well, absolutely. Yeah, that is one.
Okay.
Yeah, yeah.
Well, we appreciate you bringing that to our attention. You mentioned some of these other bills that are a problem. I understand the Mission Act was a complicated bill. I'm not opposed to speaking up against a bill that's, outsourcing mental health. I guess Suzanne's going to have to take a closer look and brief me on the bill, because some of them are more necessary. And, we got homeless vets everywhere. We got to do something for them. But it sounds like you're also concerned about some of the mental health outsourcing that's already happened on this, John Hannon, what's the name of the bill? John Hannon bill?
Yeah,
The
well-
bill that happened. So do you think maybe we need some oversight on the mental health that's already going out under the legislation that I supported in the past? It's not maybe necessarily going the way it should.
Yeah, there is no oversight.
Well, if there hasn't been oversight already, that's something I would like to lead. I would like to push the chairman to have some oversight hearings on this. I would say what would be helpful, and Suzanne would work with you on this, is, any particular location, since you have a number of veterans that you speak for, if people could get some examples of where they were in the mental health care they got and what the problems were, the kind of care they were getting and the locations, that helps us develop an oversight plan. So we can figure out what kind of questions to ask and maybe what kind of investigation to do. Do you think you could get us some of those? Go back to your colleagues in the field and
Yep.
get us.
Yep, we can get you some more feedback.
Yeah, Senator, I'm sorry, Mr. Cooley, but we do have a roll call vote on the floor. So we do have to wrap this up, but any information you could send us, any particularly personal anecdotes and any statistics or studies would be really helpful. We will, here's my card. And please contact me. I give everything to the senator, and we help.
I can't do it without her. She's terrific.
Yep, we'll be in
Thank you for
contact.
coming to Washington. It's a long way from home. And maybe we'll connect back back home when I'm here on recess. I'd love to come to one of your meetings or some
We'll look
an event
forward to
that
that.
you're
We'll be in
participating. Keep
contact.
Suzanne posted, and Suzanne has a colleague back home in the home office who could connect us to you.
All right, thank you.
All right, thank you. Take care.
Thanks. That meeting was learned a lot.
Thank you so much for your service. Okay, so now we need Group C. Group C.
This is George Otto, and I'm the spokesperson for Group C.
Great. Where are you, George?
I'm Washington, D.C.
Okay.
And first of all, thank you very much, both of you, for taking the time to meet with us. And our concern today is the recruitment of clinical people at the vision level as opposed to the individual hospital level. And we're very much concerned with this particular change in procedures because, if anything, there was a recent study of chief of staffs. And by the way, this information regarding ourselves is on a piece of paper that I'm giving to you right now. Track of us.
And you're
Suzanne,
referring,
Suzanne, please make sure you get a copy and look it
yeah, and
over.
Mr. Otto, you're referring to the Human Resources Modernization Project? Is that what you're?
I am. Thank you very much for providing that clarification. So
The secretary briefed us. He says it's a great thing. It makes everything computerized and centralized and much more efficient. Are you finding that people are getting hired more quickly and getting in the door better from this?
well, we have a study that's been done by in regard to the chief of staffs of approximately 100.
Oh, good. I hope they're happy with this. I hope you're happy with these changes. We love modernization and
Well,
computerizing everything up. Well,
tragically enough, the study indicates that these chief of staffs are actually very unhappy. with the
really?
procedure.
Oh,
They're
that's
complaining about it.
nice.
One of the issues, a couple of the issues involved in this. First of all, and of course, we'd love to have an oversight hearing regarding it. A couple of issues are, first of all, that it's taking too much time to hire people, and the kind of people that need to be working in mental health are not always readily available to us because our recruitment efforts are not tailored to the local needs of the facilities, as well as the problems that the veteran populations have in mental health. And so, we think that is very important to take into consideration. So we would like to have some sort of hearings set up. And in addition to that, we'd also like to have an independent committee to review the results of that hearing, because that way we'll have another opinion as to what the issues are, what the hearings have produced, and what changes might be made, because it's very important that these chief of staff be comfortable.
I think it's great, and I will go ask the chairman to hold an oversight hearing on this, but I want to ask you something. In the meantime, people have to get care. They have to get their therapy and their medication. So you think maybe I should just be pushing for more money for contract care in the meantime, because we've got to do something. And the VA is so slow and cumbersome, and they're so much more nimble out in the private sector. Maybe we could just get people, push them out more into the private sector to get their mental health care while we fix this problem in the VA and see if it's even fixable. I hear there's going to be this air commission, and they might just close a lot of the VAs and just totally re-engineer the thing so people get most of their care out in the private sector, which might be what we need.
It's our opinion that what needs to be done is there needs to be more services available at the hospitals themselves. There's been a dramatic increase in the number of outpatient clinics and vet centers in the last few years, but there has not been a correspondingly enough of an increase in the staffs for specialty care, mental health and otherwise, in response to these veterans who are being referred to the big buildings for assistance. So money sent to the hospitals themselves, I think, would be much more of a positive solution than
So
funding.
let me interrupt you, Mr. Otto. So you and your group, and how many people are in your group, may I ask?
We have 6 people in our group.
Pardon?
We have 6 people in this particular.
So Veterans for Peace.
We have 6 veterans who are involved in preparing this presentation today. In terms of the number of veterans who are being served, we have thousands in the DC itself, and of course this affects facilities that are within the vision that are outside of DC. we're talking about, if you're talking about a general population, that Washington DC metropolitan area has 9.5 million people. Admittedly, there aren't 9.5 million veterans, but there are veterans, a lot of veterans who are receiving care at other facilities that are within the region or being affected by this as well.
Okay, well, we understand your concerns, and the Congress, unfortunately, the Congresswoman has a roll call vote right now, but we will keep in touch, and you, to just bring closer, you want us to have oversight hearings on this human resources modernization, and I understand you want the secretary to be pressured to have an independent committee, is that correct?
That's correct, both of those things.
But what about just having human resources at, the Office of Human Resources conducting this study?
Well, I think that if we broaden the number of people, expand the number of people involved in this, we can gain more leverage in terms of making a change in the system. And I think that if it was just HR, they might be accused of being selfish and self-serving. So if we expand it, then there's less of a chance of that happening.
Thank you. All right, we'll keep in touch. Thank you so much.
Thank you for coming in. It was good to meet you. I hope to see you when I'm back home on recess. And please know our door is always open. Suzanne can give you the contact person for back home, so you can also call their Veterans Constituent Services there too, and keep us posted, because I wasn't aware that it was that bad. I thought that people were getting the care they needed.
Thank you very much, Congressman.
Thank you. Great. Okay, let's do a classic debrief, which is what did you do well and how could you improve? Let's start with A. We did all three, so let's start with, you all need to, what did we do? So A was, she was a congresswoman, and it was
Reintroduce teams,
reintroduce the team culture. How do you think it went?
It went good in some aspects, and in some other aspects I felt unprepared. I didn't have enough time in my breakout section to realize the number of representatives and or senators that were part of the 9 that introduced the bill and were supporters. And so in real life, I would have more time to go ahead and make these investigations. And so I'd have a better input of how to represent to my representative our concerns and what is going to be the best output.
But I think what you learned in advance of the meeting was not to ask for signers for the bill, but to reintroduce it, because you discovered that this great bill wasn't in the new Congress, right? So that was a really good save, because at least you came into the meeting asking for reintroduction instead of sign on to an old bill, right? So that was good.
Thanks for that.
Now, don't blame me. I'm saying that's just a perfect example of somebody thinking they have a current bill when it's a bill that died in December, 2 months ago.
Well, that's a little bit of what we did find out in our.
Right. That's what. So you did do the research. It was very good.
Thank you.
Figured that out.
And may I just point out that one of the things that you all did or didn't do in each session, and I was trying to get you to do it, you need to introduce yourself. You need to say you're a veteran, right? Where you served, and that you use XVA.
Yeah, I think saying which
Remember
ABAs
that.
you
So
use.
when you go into
Mm-hmm.
I'm Suzanne Gordon, I served in blah, blah, and I get my care at the Toma VA. So just that's your standard, right?
Yes, ma'am.
I thought, people, you obviously didn't have much time to prepare and go over the material. I think the key really is preparation, when you go in and when we had, when we all met in 2019 before COVID, we had hours and hours and hours of preparation. And it, it paid off, I think. And you don't have to put hours and hours and hours, but, just a little preparation goes a long way. And we're very limited here in what we could do. I thought you all did really well, but I really would encourage you to introduce yourself so they know who they're talking to. The other thing is you should say you represent Veterans for Peace, which has 4,000 members.
Always good to mention. Right?
Which is, gets their attention, and also, allies in lots of community members and family and friends. So, this is the big bear thing, right?
All right, thank you.
I'm going to move on to B.
Suzanne, can I make a comment quickly though?
Yeah.
So it seems to me when representatives said, can you go out and find other people who want to co-sponsor that the response ought to be, well, we can do that, but we're also asking you to ask your colleagues to co-sponsor this. Not just let them put it on VFP to do that. She's the person who knows all these people and could convince them to co-sponsor it.
But if you already shopped around before you got to my office and went to another office and could tell me somebody's already expressed interest, because people aren't yes or no, they might have said, "Oh, think about it." Like, okay, good. That means that's an office that's worth it going to ask to join us. But you're right; it's a two-way street.
I understand that, but it's for the congressman to approach his or her colleagues is a much easier task than for a small group like us to approach several people. I agree both, but I think
It's
that's
just that when it's, let's say it's a very politically challenging bill, they need all the help they can not to stand alone. That's all. But
Okay.
but you're right. We're the ones that can put out a dear colleague, and we certainly, if you have good staff, you already know, who's part of the same caucus as you, the Progressive Caucus or the Veterans Caucus. So you're right. We already have our own little caucus to go to first, right? It's no big surprise to us who's going to join us on the bill. Your point is well taken. Much more likely to get people that way.
Okay, so just moving to B, what did people feel? What would they suggest?
Well, first off, I think I could have, before anybody else says anything, I think that I should have given the standard rote introduction of myself. Second, I think we had too many points to cover, and that perhaps should have been narrowed down, but I think it should have started off with introducing the points that we chose to make with regard to the outsourcing of VA mental health care. And the third thing that I would say is be prepared for whomever one is meeting with, a staff person, most likely, as opposed to a senator or congressperson, for them to take over the conversation and or not necessarily listen. And, so there was a certain amount of that occurred here, and I understand that, but that is something for everyone to pay attention to. Get your brief outline, put it on a piece of paper and hand it to them. These are our concerns with regard to your issue, and then go forward from there. Because if you start off with a point, as I did with trust or the lack of mental health care providers, then it's going to be taken off with in conversation and run out, and you won't make that overall compact of points that are necessary to further your cause.
Yeah, I agree. And you had a complex argument to make, and we didn't have a specific bill that was doing it. It was like you were discussing a wave of bills, so it was a challenge. And you're right, the same principles applying to many of the same bills. So, and also applying to bills already in law that were already causing the problem. So you were dealing with a global issue.
I would agree. I think you're absolutely right. And I would ditch the trust argument. That is your weakest,
that's really good.
Amorphous argument. When you did really well was when you made the point about the 55% of American counties. You could make the point about, wait a minute, it makes no sense that you have high standards for the VA and zero standards for the private sector. I would really, I would move straight. I would avoid emotional issues, because the whole conversation could get derailed by trust. And then she goes, oh, these vets, they just are such a, you know.
I would also come back to the point that could be made for any issues that you're going to staff, congressperson, senator's office, and that is oversight.
Right.
Not enough oversight. Not enough oversight on the part of the on Congress's part. Quite frankly, Congress is falling down on the job.
And one of the things that the ways to get oversight is not just to hold the oversight hearing, but why the heck are the laws that have already been passed to outsource mental health care? They need to be amended, or we need, you know, to have an amendment to them or new to add oversight. So one of the things you can do is say, we need oversight, but if this law is going to keep outsourcing care, we need to build in more oversight. You know, like for example, they must coordinate directly with a VA mental health professional, whatever. So you're right. There are different ways to go about oversight, is what I want to say.
And I think it's also very important that when you ask for oversight, if the VA is supposed to do more oversight, that there's staffing and funding connected to that, because who's going to do the oversight and and where's the staff? You know, I had a meeting yesterday with Pappas's person, and he was like, the VA has to do more oversight of these contractors. And I was like, well, yeah, but how are they going to do that and provide clinical care? You need to hire more staff and you need to have more funding.
The other thing that occurred to me, David, when you're talking about psychological and psychiatric care, is to emphasize that veterans have unique experiences, and you did, but these providers don't really understand veterans' problems, and that's why it's not such a good idea to refer them to the private sector. I mean, I give you an example. If I have PTSD from being in Vietnam, I'm not going to be willing to talk about that in front of other people who haven't shared that experience. And I can't get that outside the VA. If I'm with a group of people who have all sorts of other problems, I'm not going to feel comfortable talking about things I did in Vietnam or experiences I had. So that's a really important reason why mental health care for veterans should be done by people who are trained, you know, treat veterans all the time and have come to understand their issues.
Yeah, and you know, you could point out, I mean, this is such a classic, you know, I mean, people accuse vets of being, you know, child killers and stuff like that. I mean, you think I'm going to go into a group of suburban housewives and start talking about this kind of stuff? I mean, think again, you know. But, you know, I just want to point out that even if you're talking about trust, I mean, like that example that Bruce just gave is very concrete. You want to avoid amorphous stuff, you know, like how precisely do we make you try? I mean, you want very pointed anecdotes, right? If you're going to be sort of talk about emotions, right? I mean, David, yes?
Yeah, I do have, I'll take a little bit of an issue with the whole idea of not bringing up trust because it's an amorphous issue. I fill out countless surveys to the VA after I've gotten care from there. And at the end of the questionnaire, they're asking me, do I trust my care at the VA? Do I trust the VA? And I always rate trust of the care providers at the top, but I rate down my trust in the VA itself because that's the VA in Washington, D.C. So right there, that tells me that trust is an issue and it needs to be dealt with maybe in a more concrete manner than what it has been.
Yeah, I wasn't arguing that you shouldn't mention trust. I wouldn't lead with it.
Yeah.
Okay.
I was going to bring that up too. I just, when you said that, I was going to say one of the most positive things I heard was the trust issue, because I've been betrayed so many times. You know that trust is a big factor. But I do think that, like you said, that the reason for trust there, though, I thought was a good idea. How are people going to trust you when it comes to an election? Unless you know you want to be trusted, then you got to take it to the concrete level of saying that, you support veterans, you have to have concrete examples and people will trust you and want to vote for you. Maybe that's at the end or something like that.
I also want to say that members of Congress are much more interested in oversight when they have a specific set of rumors or scandals to work with, So I'm not saying you probably can give them some pretty bad stories. If you can show a pattern, then they have some reason to get a study done and hold a hearing. So you know what I'm saying? The problem can be very bad, but if they can, because if they have something that could make media headlines and that also they don't want to get in trouble for neglecting, and they have a greater incentive to do something. So that's all. You just kind of have to build it up or get more. That makes sense. I mean, you have real problems there to deal with. It's just that.
Well, that oversight issue is not unlike the trust issue. It can be amorphous or it could be more.
Sure, you got to just make it more. Right. That's all.
Yeah.
And I mean,
I think we have to move on to the third, but I think that the main thing to remember is that when you go to meet a congressperson, you have to engage them in something they care about, which may not be something you care about. And that's the tragedy here. And something that will grab them. And so it requires sometimes a little bit of giving up but we do need to move on to 3 because we have like 5 minutes and
okay, so the next one is HR reorg, correct? That was
Right.
our last group. Mhm.
right. George, you're muted.
Okay. How about now?
Yes, you're fine.
Good, and we can hear you very well. Mhm.
Well, thank you. First of all, I failed to properly introduce myself. I should have introduced myself not just as a veteran, but and a person that's used the VA, but probably would have helped if I'd said that I've been to at least 5 VA healthcare facilities over a period of more than 50 years. So that would have been good. One thing that I felt that I did not do well is that I did not have a handle on how many members of VFP are residents of Washington, D.C. I did not have a good figure on that. And also, I think it would have helped if I listed the number of veterans in Washington, D.C.
And I suggest, by the way, George, that for all of you, that's a very good piece of information, and it should be on everybody's one-pager going forward. It's just good standard information about the national group. So I would add that paragraph to every one-pager.
I did not offer the sheet early enough in the presentation. I did it after a while. And then I also did not ask what we could do for the congressional representative. And I think that's really important in our situation here in DC, because our representative doesn't have a vote. And also because from a geographical standpoint, we're so close to, districts in both Maryland and Virginia. And there are a lot of veterans who live in Maryland and Virginia who use the Washington, D.C.
That's very true. It's true. It's the whole DMV. I mean, that really is a good argument.
So those are some thoughts that I have.
Right. When it comes to, you're right. Right.
Maybe some other people who are on my group have something else to add, Bruce or Daniel or what have you.
Well, one of the things we talked about, and I think when we actually meet, we can stress is how much different each VA facility is and how much different each labor market is. So
Yes, very important.
I worked in Erie, Pennsylvania and in Denver, Colorado, and those are much different markets. So responding to that market is a different, and you can't do that remotely. You really have to know that. And then secondly, emergencies come up in a medical center. I mean, staffing shorts come up, and there are all sorts of ways to address them, to appoint people temporarily, things you can do that can be done by a local office that can't be done by a remote office. And so staffing at a hospital is not like staffing at a factory. It's not assembly line. And third, when you work in a highly affiliated medical center, the medical center, medical school has a lot of influence on who's hired. And so you really have to coordinate with them, and that's something that has to be done locally. That's not something that
Right.
is done remotely. I mean, that the relationship between that medical school and the hospital is key to getting the right staff and providing the right kind of services to
Very
veterans.
good point.
That is
And
a
Those are
very
two
good point.
And one thing about the VA, it may be government, but when it comes to the healthcare facilities, they operate locally. They don't have to go through some national register. They're
Yeah.
dealing like any other hospital in the community, in the market locally.
Yeah.
So you're right.
Healthcare, despite what they say, healthcare is local
Right.
and depends on the local circumstances. So those are points I think we can make pretty strongly to argue against any kind of centralized system.
I'd
It's a
just
great
like to say
point, but we gotta, it's a terrible thing. So that's a great point for fighting this
Very good.
terrible reorganization.
I'd just like to say one thing, and that is, I'm so thankful that we have Bruce, Ray, and others who have experience with the VA, working for the VA, in this group, because that perspective we wouldn't have among the rest of us.
That's great. I agree.
So this is, I think, the end of our part. We are probably 15 minutes maybe over, which I think isn't so bad. And I thought it was great. I think that, you know, you did really well for just kind of improvisation.
Very good. They were good meetings. They were very good meetings, actually, really good. You really made your cases very well.
So
Difficult issues,
I'm going
too.
to hand it over to Jeff, or who?
Yeah, Jeff.
Thank you, Marilyn.
Thank you all. I owe you all a handout. Please look for something in Samantha's wrap-up email. It was a pleasure, and I'm sure we'll
Thank you,
keep
ladies.
talking.
And thank you both for all the information you provided. We appreciate it.
I want to thank you all. That was-
All right,
that was
take
great.
care. We'll see you again soon. I'm gonna take off. Bye-bye.
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 Before you take off, I hope you're still there. I want to just compliment both you, Marilyn, and Suzanne. You did an incredibly good job being a congressperson and staff, and especially at those times when you were a pain in the rear. So I just want to give you kudos for that.
I'll second that. They were wonderful.
Okay, so now we're in our wrap up here, and I just want to note that we are going to be getting a hold of each of those of you who are still on the call, but those who were on, who had to leave early, and to some that weren't able to get on the call, in order to set up these, to coordinate these sessions that I've been working on to set up with congressional members and or their staff. And we've got about 10 of them already set up, and others that are in process. So that's just a FYI, we'll be getting a hold of you. And during those sessions with them, we'll only have probably a half hour at the most, unless they're not busy, unless they're particularly supportive, And I know that when we were in Washington, D.C. in 19, we had anywhere from 15 minutes, very tight, to, you know, possibly a half hour, something like that. It all depended on the representative. So we'll prepare accordingly, and then depending on who the congressional person is and who the veteran is that will be on this future Zoom session, either I will be in the background on that session, or Arliss or Bruce, or there may be, you know, I don't know, one or two other people who will be on your session. Unless, you know, there's two of you in the same district, and then you'll both be on. And but we'll try to be in the background and and, give you the floor, the front stage, but always there to support you. And I realized that my tablet is running out of power and I've got to plug it in. Bruce Arliss.
I think on Monday, Sam said she'd be sending you all out an email. And I know Marilyn's going to be attaching to that notes that she's prepared. And I think we can also, with that, attach a list of everybody, the meetings that are already scheduled. I think we've been in contact with most of you to let you know if we have a date already. But we can send that out Monday. If somebody else is interested in joining with, say, Ray wants to maybe come and join in with Doc's session, let us know, because I think that would be good. And I think that's all I have to say right now. Bruce?
One of the things that I told people was that before we have these sessions, we could meet with them again. And the group I talked to, I said, we could talk more about these details and role play a little bit. And I would serve as the member of Congress so we could get into more detail. I mean, they didn't have much time to prepare, so we could actually go over the points.
We had zero.
And then, we could practice a couple times, and then I think I could think of the questions the congressman might say, well, what about this? What about that? And then I think they'd be better prepared for the meeting. And, we can make up a little script. I'll do that today or tomorrow. Introduce yourself, say this, the kind of thing Suzanne said. We can send to everybody so at least they know what procedure should you follow, the introduction, who you are, you're a veteran, you get service, you represent so many people. This is the issue I want to discuss. And so I think if we do that and we do some role playing, practicing with people, I think it'll go well. I think for the limited time people had, they did amazingly well. I mean, they really had to think on their feet, I think, and that's not easy to do. And I think the people who were the leaders did a really nice job.
I concur. Does anybody have any questions or want to make any comments or anything else?
I'd like to
It's
just say.
been nice to put together some faces with names. I'm the one who keeps data for SOVA. So like keeping track of everybody that sends CTAs and whatnot, so we have some information. So it's nice to put some faces with names.
It was
This
nice
is
for me
Daniel.
to understand my money where my mouth is with how much I care about the VA. So thank you for the opportunity to attend this today.
Thanks, Ray, and thanks for joining VFP.
Yes.
I just wanted to say that, I got a call here for an interview or to a speaking engagement with actually a local communist group next in March, I think March 2nd. And I told them that I was really interested in talking about VA healthcare. And they said that they would be really interested in hearing about that. So I will have a little bit of practice.
There you go, comrade.
I love it. I love it.
Yeah. So,
I think that.
but the thing is, we can take this out. We need to take this out to the general public in every way we can too.
Sure.
So one of the things that I think, we can do, and we did do this a little earlier, is, this was kind of a lobbying effort, but we're going to master all kinds of things about the VA that some people don't know. And I'm increasingly finding that the Medicare for All groups and social justice groups are very interested in this now. And it's probably worth, having, I'm going to be speaking to Minnesota Medicare for All groups in April, and it's probably worth, getting in any place that you have contacts with these groups. Bruce is now on the monthly Medicare for All call with Congresswoman Priapol's office. And, we need more allies. We don't have them in the VSOs. So increasingly, I think that's an opportunity for folks to explore if they have the possibility of making those kind of connections wherever they live. These groups are all over the place, so.
Can I make one comment? We were advised to use the term advocacy rather than lobbying because we're tax exempt organization.
Yeah, sure, whatever, advocacy, great.
Yeah, so I'm trying now to train myself only to say advocacy.
Yeah,
it's hard to get out of the habit.
It
I
is.
would say, in following up on what Suzanne said, and you probably know this, Suzanne, our chapter here in Minneapolis has a real close connection with Healthcare for All Minnesota. And so we have been developing that over time. They've actually been out to some of our demos. And also that we've been extending ourselves to labor unions as well. So yeah, there are other groups out there that is important to reach out to, as you said and as Dan was saying too.
I think I misspoke. Did I say Minnesota? It was Indiana.
Oh, that's okay.
But I think that one of the things that I would love is to be able to, talk to folks about their experiences. We've gotten to, Bruce did a kind of a blog post for VHPI and Bruce McDonald, and any of you who want to work with me on, you all have said great things about the experiences you've had at the VA, and we need to get those out to the public. I also really want to re-emphasize that those of you who haven't signed on to the VHPI newsletter should, and you should visit the site, because we have all kinds of, if you want to prepare for meetings or anything, that's a really good place to go.
Can I give that an endorsement? I have to say the VHPI website is the one place information on what's happening to the VA. If you don't read anything else, if you look at this website, you'll have a good idea of what's happening to veterans health care. And donate to it.
I'm going to sign off now and go be a grandmother, but it's always an honor and a privilege to deal with you all, and I think I have some of your emails, and I may reach out to you, to find out more about your experiences. And it's just been great, and I thought you did such a great job. And like I said, I mean, I'm a broken record on this, and I'm unabashedly broken. VFP, SOVA, you people, I mean, you are standing, we are the only ones, literally, VHPI and SOVA, standing and making trouble for these people. And I want you to know that we are successful. I mean, my article and this is not to say I'm not bragging, but maybe I will brag. I mean, the article that appeared in the American Prospect about human resource modernization caused them a lot of trouble. We are getting an oversight hearing on the part of Takano. Takano's going to hold an oversight hearing. The secretary is maybe launching some kind of independent commission. You can gum up the works and make them pay attention to you. Just a tiny little gnat group. I mean, VHPI is like, we are like a flea. You guys are a fly, we're a flea. And, fleas bite, and flies, particularly black flies, it can be.
They
really...
bite.
They do too.
So do not ever feel, I mean, it feels Sisyphean, and it's a pain, but, we are having an impact, and I just applaud you all so much. It's such a privilege to work with you. And just go for it, so thank you so
Thanks,
much.
Suzanne.
Thank you for working with you. George, you have. I want to make two quick comments. One is the Vietnam Veterans Against the War is very much in terms of supporting Save Our VA. Well, what they're doing, I'm not sure, but I know that they're involved. And the other thing I want to say is a great resource to find out what's going on with the VA, particularly in conjunction with the military, is to go to military.com. That's a
Yeah,
great
and the other thing I want to say is that, you know, you now have a new board at VFP. And this whole issue of common defense needs to be revisited. I mean, I'm working with them a lot. This air commission is going to, we could have done a whole session on the air commission. Maybe we should think about that in you know, when after March 14th. But this shit is going to really hit the fan, and it's not, I don't think it's going to be good. And so, you know, stay tuned. But I think these kind of meetings are really great. So take very good care, all of you.
Thanks,
Okay,
Suzanne.
I want
Thank
to
you,
go back
Suzanne.
to George.
George, can I
George.
ask you a question?
Yes, go ahead.
So I'm a member of Vietnam Veterans of War, and I wrote them a letter asking for cooperation with SOVA. Never got a response. Do you have any personal connections with the office that I might contact?
Yeah, contact Joe, who works out of Champaign-Urbana.
Joe, can you send me that information in an email?
Sure, give me your email address.
It's B Carruthers, CARRUTHERS, the numeral 1 at charter.net.
Okay.
Yeah, because I wrote them a long letter and made a donation. I didn't hear back. They could be valuable. I wanted to know if they would let us share information with their database. So if you have a person I can contact, I'll do that.
Yeah, he's a high muckety muck.
Yeah, I know that's where they're located. Yeah, so if you can do that, can I use your name when I contact them?
Yeah, they've been sending me. I've never joined the organization, but because of him, he's been sending me stuff about them for over 40 years.
I was a charter member. I was a charter member of the Syracuse University chapter in 1968.
Wow. Okay.
Well, a lot of them are actually both members of Veterans for Peace. And
Yeah, I know they are, but if we could get access to their database to send stuff out, at least ask, it might help. There are many may be interested in it.
And About Face is another group, you know, you're talking about former Iraq veterans against the war. They are
Dan, what's the
also,
name of it?
About Face now. It's the former Iraq veterans against the war.
About
I
Face,
also-
okay.
I would like to go back to what George said. Were you saying check out military.com?
Yes.
Okay, so that's
Yeah,
just
a lot of really good stuff, particularly in terms of the relationship between the military and the VA.
okay, just so that people heard that. And then finally, and it's, I can't say it enough, I want to thank Sam, who's the tech guru behind all of this, all of these breakout sessions and being able to see each other and talk to each other and da-da-da-da. If it wasn't for Sam, this would be a total flop. So thank you, Sam.
So Sam, show yourself so we can thank you.
So show us so we can thank you.
We can give you an applaud.
Yeah.
Oh, no. All right. Keep in
boy.
mind that it's a Saturday.
That's all right. That's all right.
That's all right. All right. Thanks,
It's a
Sam.
Saturday for all of us.
Bye, y'all.
Yeah, thanks.
Thank you.
You
Thank
did a
you.
wonderful job.
Thank you. I'm glad this went well. And I will send out that recap on Monday afternoon.
All right, thanks.
Wonderful. So we'll be in touch with you folks.
And Jeff, Arliss, and Bruce, I didn't get to say this to Suzanne before she ducked out, but if that flea has a way of working, that VFP is one of the only veterans organization that is actively supporting the efforts to try and stop corporatization of VA healthcare.
Yeah.
It wouldn't hurt.
There was one more issue that hasn't been brought up, and that is getting our meds. I'm diabetic, and I test my blood glucose every day. And since the Mission Act, they have changed it so that I'm supposed to test myself every other day. Well, I haven't, sometimes my blood sugar goes up high, and I test two or three times in a day just to make sure to compensate. I am right now 3 days left on my glucose, and they're not going to give me other strips till April 4th or something like that.
Good
I have to go out and purchase off at a pharmacy. You know, I bought a whole system so I could compensate in between because I need to test. That's how I'm maintaining my health. Now, I'm also in a pain clinic, and this other veteran who's in a wheelchair said he was dealing with the same problem. He tests 4 or 5 times a day on a regular basis. And just last week, his blood sugar was so high, he passed out and they had to run him to emergency. Now, this is a crime in my view. They're killing veterans if they can't get the necessary meds that they need because of this penny pinching shit while they're ready to pay billions to some manufactured war. And I think we need to address that also.
Yeah, $1.7 trillion to develop the F-35, which is not operational, 78 million for each plane, 120 million with maintenance. And Congress argues over whether they can afford to take care of all the people who fly these planes and service them afterwards. It's just absolutely ridiculous. If all the things that make me angry, that's among the highest.